Hello, hello. Welcome, welcome, welcome. Welcome to the Barbershop Health Talks. My name is Aaron King. I'm Secretary for the Capital City Black Nurses Association. And I'm here with Lance Woods, our host for this event.
Yes, you are. And thank you. Keep talking.
Should I put it? Was there S or is there no S?
On my name?
Yeah.
Woods.
Woods.
Plural,
with a
plural.
Z or S?
With
Cause
an
you
S.
okay?
Multiple Woodses.
Because your enunciation was a little.
Woods.
Woodses. So we're here live at the Guild Theater here in Sacramento, Oak Park to be exact, and we are bringing you some good programming today. We are focusing on men's health. So we have a lot of guests here. We got who we got?
We got all kind of people. We don't want to give it away. Y'all got to sit and watch, and y'all gonna see everybody we got here. If y'all just have some, you got time. Focus on your health today. Pay attention. You're going to get some information and apply this information. We got all kind of people. And most importantly, we got y'all watching. That's who's the most important.
So
we got you, Aaron. You got nice shoes on.
Thank you. These is fresh out the box today. Just broke them out. I see you. Okay, got the breads on.
Oh, just the first day wearing.
Yeah. The aquas,
pull them out.
I had to pull the aquas out today. You know, it's a special event. So we will be live in a couple shops here in Sacramento. I just wanted to make sure I shouted them out. We have CC's over in North Natomas. We got 5-Star Fades, Del Paso Heights. We have Spotlight, Elk Grove Florin. And then we also have our right next door world-class faders. Lonnie let us come into his shop. And so we'll be streaming live into those barbershops, providing lots of men's health topics, focused on health prevention. We're going to be talking a little bit about COVID-19, just a little bit, just like safety.
We're going to talk about health prevention.
Yeah.
Like
so
how to prevent yourself from being healthy.
Preventative health. How about that? I said it backwards, and that's my bad. So we're going to talk about hypertension, diabetes, colorectal cancer.
We're going to tell you everything you need to know to mess up. We do not want you to be successful with your health.
We're also going to be doing. We're also going to be promoting the health professions. Myself, I'm a registered nurse over at UC Davis Health, who is a wonderful sponsor of our event. But I've also worked in a couple different places. I do a leadership role over there at the hospital. Is very, very fulfilling, the job. We also have a couple physicians here. We will also be touching on a little bit of community health. We're going to be talking about partnerships, things like that.
Community health. We're talking about mental health.
Mental health, okay. Yeah, mental health. I forgot that one.
Yeah.
We're going to be talking about fatherhood, manhood, all those good things.
Parenthood, the hood, Oak Park, Valley High. We're going to be talking about it all.
You throwing out sets now?
We're talking about car hoods. What's in your engine? Is your check engine light on? Take care of that. We're talking about it all.
But like I said, shout out especially to our wonderful sponsors. That is Betty Irene Moore School of Nursing at UC Davis. Their Office of Health, Equity, and Diversity helped us out a little bit, and then UC Davis Health especially. And we'll go ahead and switch over to Carter Todd, our president, unless you have something else to add.
No, we're going to have a good time. Appreciate y'all coming through. We're gonna have fun. We're going to learn something. We're gonna challenge some things, and yes, hopefully we all leave this event feeling better and more educated, and excited about taking care of ourselves in a better way.
Definitely. So, like I said, Carter Todd, president of Capital City Black Nurses Association, is going to be coming from you live from World Star Faders. We're going to give you a little bit of music before we transition over. Thank you.
Is Carter's over there now?
Carter's over there now.
Okay, we gotta switch this around. It's Todd Carter. You can't put your last name in the front and your first name at the end.
He got two first names?
Or he got Carter's a last name, but he just put it in the beginning.
Good afternoon, everybody. Thank you all for coming. Huge shout out to the Barbershop Talks. I'm here with my friend Tashaka Muhammad. I'll talk a little bit about him in a short amount of time, but really I just give a huge thank you to everyone who's viewing, to everyone who's believing in this process. It's the first time doing it, so I appreciate y'all dealing with us. I think we started, 6 minutes late, but we're going to get back on track. And as Aaron talked about, we're going to be shooting out to the East Coast, staying on the West Coast, so stay with us for the afternoon. Learn a little bit of something about COVID-19, mental health, preventative health, just a whole gamut of things that affect our Black male community. So I'm really excited, and that's enough for me. I'm going to introduce my friend here, Mr. Shaka Muhammad. So I'm going to read here. He is a mental area. He's a creative performer who has taken lessons handed down to him and his family and turned them into pearls of wisdom, and he passes those on to others. And I've been fortunate enough to gain some of that knowledge in our time knowing each other. During his 33-year career as a health educator, community activist, and organizer, he has developed innovative, culturally competent community education plans, similar to something like this, the Barbershop Health Outreach, served as an assistant to a federal administrator of community health education for the Center of Disease Control, and used the spoken word to educate the children, families, and other community members. Dr. Muhammad is a founding member of the Sacramento Birthing Project and a nationally recognized maternal and child health projects. Dr. Muhammad received his Bachelor's of Arts from San Francisco State, Master's in Community School Education from California State University, Sacramento, and is a doctorate in metaphysics at the Metaphysical Institute in St. Louis, Missouri. So I humbly am introducing y'all to Dr. Muhammad. He's going to give us just a little bit of background about community health outreach here in Sacramento and why this program is so important.
All right. Thank you. Thank you, man, for inviting me.
Of course.
Like you mentioned, we're here in the barbershop.
Hey.
And this talk about Black history and histories every day. You see, the barbershop in the Black community is the country club. See, the barbershop is where maybe a single mother brings her son for his first haircut. A barbershop is where you come to hear stories, you hear lies, you hear truth, you hear political statements. This is our country club. It's a ritual. When a woman comes into the barbershop, usually then stop talking. Okay? So it's important. The barbershop, the church, the funeral home, and the liquor store have always been staples in our community. Most of the time, we have owned them. Gentrification is just another word for colonization. Okay? So, but we here to honor the people that are doing on the front lines. People like Carter, the Black Nurses Association, all the health education. I spent many years recruiting people into medical schools and schools of public health. Now, there was a brother here who was also an educator, premier educator, Frank Withrow, who just passed recently. Frank Withrow and Alan Rowe here in Sacramento have been responsible for more Black students being into medical schools and schools of public health than any institution. When we talk about health, we're talking about whole health, okay? We're talking about the whole body. We seem to practice European medicine and we divide the body up. You go to one doctor for your eye, ear, nose, and throat, and another one for your kidneys, another one for your feet. It's a whole body, okay? So when we start talking about, folk medicine, which they're now beginning to bring into understanding how important that is in terms of culture. Callie Carney, right here in Oak Park, lady way ahead of her time. There's not a person in Sacramento that has not benefited from what Callie Carney has done when she was on the city council and brought money in. In fact, this barbershop right here is a result of what she has done here in Oak Park. These are people that need to be honored. Yeah, we have famous people, Martin Luther King, we have Malcolm, we have all those, but we have who are heroes, who you will probably never hear about, okay? But these are people who are on the front line. These are people who are committed, and like I was saying earlier to Carter, commitment is like a bacon and egg sandwich. See, the chicken is involved, but the pig is committed. Hey. Okay, so that's the way we have to be. Yeah. Because it's like teachers. You ain't in it for the money. It's to make a difference. okay? It's just to make a difference. And that's what we need to do. Some of you know me as the founding father of the Birthing Project. You know, in 1988, I was working for the state of California, Office of Statewide Health Planning and Development, doing community education. There are a number of clinics here in Sacramento that I've helped establish and get built. And Catherine Hall Trujillo was working for Department of Health Services doing infant morbidity and mortality statistics. And they were just numbers to her. But these were black babies, disproportionately dying. So she asked me if she could come to a clinic with me one day. And sure, okay. We went to this clinic and there was a little baby, a premature baby named DeAndre. And I was holding the baby and Catherine asked me to hold the baby. And when I gave her the baby, she held it for a few minutes and the baby died in her arms. She did not go back to her state job ever. That day, we started the Birthing Project. She said, we were gonna do this for a year. We did it for a year and the county was surprised at the difference that it made in using Black traditional family values to birth, raise children.
And that legacy is absolutely important to anything that we do, right? We're here now as Capital City Black nurses. We're in the barbershop, but we only here because of great men and community members like Shaka Muhammad and those who have came before us. So I appreciate you for giving us some context. I appreciate you for joining us here. Everyone that's viewing, if you haven't already, make sure you pick up the survey. Give us some feedback. Let us know how we're doing, how we could do better. Come on down. We're doing a COVID-19 screening out in front. We have some giveaways. We have some of our people down here on the front line. So we'll be tapping in with you a couple of times. You'll see me back and forth, but really we're here to lift up our next speakers. And Aaron will introduce them and Lance over there at the Guild. But really excited. Trap Medicine coming to you all next. So stay tuned.
All right. Thank you. All right.
It's microphone right here. Make sure y'all. No, check, mic check. 1, 2. Trap Medicine. Action.
Thank you. I appreciate that. I'm Dr. Edwin Kalubia, neurosurgery resident here at UC Davis. Been up in Sacramento for about 5 years and have been involved with Trap Medicine since its founding. You know, before we start, this is Tyler Brown. I'm going to pass him the mic. We'd be remiss. Our founder, Jamil Lacey, who started Trap Medicine about 4 or 5 years ago out in Oakland, basically barbershop intervention that we'll talk more about. He's down actually doing his first year, just finished his first year of medical school at UCLA, and we'll talk about some of the programming that we've done down there as well. I'll pass it over to you.
Yep. Hey, what's going on, y'all? Dr. Tyler Brown, emergency physician at Stanford. I'm a Sacramento, California native. Also been around with Trap Medicine since the inception. Jamil Lacey is a visionary. He brought us all together under this idea of providing care, specifically health awareness to communities of color through the barbershop, which is a very well-known safe space in our community. So we use that avenue to do things, everything from testing to health advocacy, health literacy. That's our goal with trap medicine.
Okay, so y'all talked about it a little bit, but can y'all go into a little more depth about how trap medicine got started?
Yeah, so I think there's data and literature that supports, we talked about earlier, the barbershop kind of being a safe space, a venue where, not only is it a place where, you can get some form of therapy, community. That's the best way to reach the people when you think about community outreach, right? And so we took some of those models, and TRAP, it basically stands for trust, research, access, and prevention. So the goal is really to establish trust within the Black community in medicine, right? We want to establish platforms for research because we want to make sure that we're included, in the clinical trials and everything that's going on when it comes to medicine. Everything we do and the way we practice, we try to do everything evidence-based. But we want to make sure that our people are included in that evidence. The next part of that is access. And so again, the access point comes from us, Black physicians, Black nurses, coming out to reach the people where they are, in the barbershops, in the communities, and then finally prevention. Our final goal is also to plug people in not only with the information, but also, give them access to primary care physicians so that this healthcare, the discussions that start in the barbershop continue in the medical clinics and hopefully, prevent some of the conditions that, unfortunately plague Black and brown men at disproportionate rates.
So tell us what TRAP stands for one more time.
So it's trust, research, access, and prevention.
I will never listen to Young Jeezy the same way again. I had
Exactly.
no idea that Gucci Man was on to something so powerful.
Man, it literally, the idea of the trap and something being inaccessible or having to struggle to get out, we just flip that on its head so that it means something powerful, and it is empowering to feel like you have all of these different elements. You have trust, research, access, and we can prevent some of these illnesses.
Absolutely. You took something that people know of and you changed the meaning of it.
Yeah.
For something that, that's fantastic.
We're doing the best we can with it.
No, y'all doing a great job. Now let me ask you this. How should barbers and men visiting the shop navigate things safely?
So the first thing is, right now we're in the midst of a pandemic. I know it doesn't seem like it because we kind of had some decline in the numbers, but we're still in a pandemic.
Hold on one second. If you're watching this from Atlanta, there is a pandemic
going on in other locations, and it's about safety. Some of the recommendations that we've had, for the most part, are continuing to wear masks, continuing to use cleansing materials and things to create or to reduce the likelihood of transmitting any type of viral infection. These practices we've seen become effective, and we've seen the trend of cases go downward because of us buying into them. Now, for barbers specifically, understand that this is a job where, there's not a whole lot of protection in terms of insurance. So most barbers are 1099 employees. They're people who have to work in order to eat and to live. And that puts them directly in the pathway of some of these issues. And so we just encourage brothers to be not just educated, but beyond educated, like understand what it means as far as your role in society. Barbers are therapists. They are highly skilled communicators. They are mavens of knowledge. And so as that resource, you could do a whole lot just from behind the chair.
Hold on, let me Google maven.
Maven. Yeah, man. Y'all got that one.
I don't got that Stephen A. Smith word in my vocabulary right now. He said, did you know you was a maven? If you a barber, know that you a maven. Put that on your resume. Whatever.
Yep.
So you're a neurosurgeon.
Correct. So I'm in training right now. So I'm in a residency program here at UC Davis, year 5 out of 7.
Okay. And
ER doctor.
ER doctor.
Right.
Okay. That's like the TV show.
Yeah.
Yeah.
Just like
He work in the
in the right.
In the Explain to the people what a neurosurgeon is.
So a neurosurgeon, we basically deal with conditions of the neurological system. So that being the brain, spinal cord, peripheral nerves. We're different from a neurologist in that, we see the problem and we actively fix it with our hands by doing surgery. So whether it's, in a trauma setting, I might get a call from Italo in the ER saying, hey, there's been a family, there's been a car accident, You know, this woman's got a subdural hematoma, basically bleeding on the brain, and it's my job to go in, operate, and evacuate or remove that bleeding. You know, we also cover things from brain tumors, aneurysms, lumbar discs. So it's a broad field, you know, but I love it.
Craziest thing you've seen in the ER.
Man.
Well, hold on, I don't want to say crazy. That's not the word I want to use. What was the most jarring thing that you experienced as being a maven of ER work?
I mean, jarring is always wild. Like I've had people fly from other countries with gunshot wounds just so they could get care in the U.S. I've had people who've had undiagnosed cancers, and when you scan them, you see that the cancer is everywhere. I've had people who've fallen from almost every single height that you can think of, and been able to see them actually admitted to the hospital and even walk out. The worst thing that I think I could think of is on my birthday, it was like a meth lab in New York blew up, and we had probably like 15 people come in, and one after another, it was just like a different issue, whether it was actual burn injury from the explosion or inhalation injury from breathing in the fumes. Someone had a heart attack. Someone was on the way to, the firefighter was on the way to the explosion and like ended up severing part of his arm. So it's like you see all of that and you have to know what to do. With that said, I definitely call specialists like Edwin all the time because the main distinction that he said is that intervention, like being able to actually do something. Our job as ER docs is to resuscitate and stabilize and make sure that anything that can essentially be improved in the interim, we do that. But he's the one that comes in after and goes ahead and evacuates or does the decompression surgeries, things like that.
That sounds like a lost episode of Breaking Bad.
Yeah, no. It's ridiculousness meets Breaking Bad.
Man.
You see everything in the ER. You know, it's everyone comes in there. You know, and unfortunately with our healthcare system, he didn't touch on it. Is that a lot of people are going to the ER for primary care. And so what we're also trying to prevent is, you don't want that cancer sneaking up on you. You don't want that high blood pressure sneaking up on you, that high cholesterol to where you're coming in with a stroke. We want to get that early, and that's part of the prevention piece.
Let me ask you this. When you talk about prevention, when we're talking about cancers, high blood pressure, those things, what is the best preventative way to deal with, let's just say, cancerous things?
So Edwin spoke very clearly about this. It's about having engagement with the healthcare provider, and early and often is what I like to think about. We do have some social issues that impede our ability to do that, specifically for communities of color, right? But the hope is that we're getting monitoring constantly. You know your status of things, whether we're talking about you understand what your blood sugar is, you understand what your lipid levels or your cholesterol levels are. You have had an EKG in your lifetime. Things like that are ways of us monitoring it. For cancer risks, especially as you get older, you should develop a more intimate relationship with your physician. So that means you need to be having these conversations with the primary doctor around colonoscopies, when you should get one, around knowing that you need to get certain blood tests if you have family members with these issues that are already existing or who may have passed from them.
What about what role does diet play in this?
I mean, diet is essential. So when you think about the metabolic diseases, when you think of something like diabetes, high cholesterol, hypertension, high blood pressure, diet and exercises are the two kind of basic things. When you see your primary care physician, if you incorporate that early and often, you can prevent a lot of these things by speeding up your body's metabolism, losing some of that excess weight. All of those things, that we know of that make sense, that are just hard to do, we know what we should be doing, right?
Chick-fil-A is delicious.
But Chick-fil-A is delicious, you know what I mean? Fixins is delicious. All these foods, but everything comes in moderation. You know what I'm saying? And there are healthy options everywhere. You know what I'm saying? And so, not to knock any of the things we love, but it all comes in moderation and knowing what, as Tyler said, what your levels are, and so that you could be proactive if there is a problem or there is a concern with your blood pressure. If it's starting to creep up, if you're starting to get in that pre-diabetic range, there's things that you can do.
Yes. Now, what would you guys say you're most proud of that trap medicine has accomplished so far?
Wow. So I think just the growth that we've had over the years, you know, the work that Jamil Lacey has done, as Tyler said, he's a visionary. You know, as a first-year medical student in Los Angeles, we were able to partner with Charles Drew University, Kaiser Permanente in LA, and pretty much during the pandemic, we were able to establish weekly testing and now vaccinations in Compton, at a barbershop in Compton. And so that incorporates everything that we're trying to do when it comes to, you know, establishing the trust with the information early and the COVID testing. And now we're actually being out there providing these vaccines at the barbershop so that members of the community have that access. So I think for me, that was one of the biggest things.
Yeah, so just to add to that, I think that the acceptance of this model of care is a huge accomplishment. Trap medicine has been pushing this, I would say, honestly, since 2013, 2014. We know that barbershop health interventions have been around since the late 70s, but it's very hard for the general public to accept that this route works. We've had to see study after study demonstrate the actual efficacy of barbershop health interventions. Trap medicine really just said, we're going to come from a different angle. We're going to be focusing on barbers. We're going to focus on community members, educating them. And that model being embraced is a huge accomplishment, to the point where, like we just saw in the past week, President Biden wants to do an entire thing with barbershops to increase awareness of COVID and try to, increase the vaccination rate. You're talking about a whole national campaign built around barbershop interventions, which is something that we've been doing for the last 8 years.
Yeah. Do y'all know of any other organizations or things who have done things similar to trap medicine? Or are you guys the first and only, the innovators?
Well, if you're talking California, we're the preeminent resource.
Say it louder.
If you're talking California, we're the preeminent resource.
Say it one more time, because the people in the back couldn't hear you when you said y'all was the prehabilitation. What was the word you used?
We are the preeminent.
They are the premature, the prenatal, they're the preseason leaders.
The
mavens of preseasons.
There's a bunch of organizations that do barbershop health interventions across the nation, and we communicate with them. We're in that field. We're among the leaders, and I think that it's important to really, really emphasize that places like California that have such a broad landscape need to have people who are from the area who've done this work, and that's kind of where trap medicine stands out.
Okay. Now, you mentioned that one of the things that you guys were doing were providing vaccines at barbershops, right? So you come in and say, let me get a low taper and give me a shot.
Right. Caesar and
yeah.
That's what it is. It's access. It's ease of access. It's the, having it there. One of the things we were worried about overall was the equitable distribution of vaccines, making sure that our communities weren't the last ones to receive the vaccines. And now we've seen, we have the supply. It's just the demand. We got to increase obviously the education and the trust. It really started, some of this happens organically. I got my vaccine back in December. I came in, felt vaccinated, got a cut with Lonnie a few months later, and, talking about everything, but one of the things that came up was the vaccine. And so these are things that happened with just me and him talking. He appreciated the conversation and the things I was able to tell him about clinical trials, and I enjoyed sharing that information. And so that's what we're just trying to do on a larger scale, where we give the information. We're not trying to push an agenda. We're not trying to push vaccines, but we want to hear your concerns, and they're here for you, right? I can say it's safe. Atal can say it's safe. We've seen the numbers go down. We've seen the evidence. And if you have any questions, feel free to reach out, and we have the vaccines. That's what our plan is.
How was that received in the barbershops? I would imagine that people's in the shop was like, I just want my cut going on.
So barbershops, we have conversations about who's the greatest basketball player, LeBron, Kobe, Mike. We talk about like family members who are acting crazy, girlfriends who may be going, really bonkers on guys or whatever. We have all these conversations. And so just like that, there are opinions around the vaccine. our goal has never been to, like you said, push an agenda. It's really to be a source of reliable information, to break down some of these myths and misconceptions, and also to encourage people to accept that they can control their health knowledge, that they have access to those things. So yeah, we get everything from, microchips and 5G is in the vaccine, causes, magnetism. We've heard all of that, those theories. We've heard about people saying they would rather use turmeric and a bunch of natural remedies. We don't condemn those ideologies unless they're outright wrong, but giving perspective, context, and then sharing personal narratives, just as we just did here, is how we reach people and convert them into people who are equipped with knowledge, not just someone who's going by hearsay.
Mm-hmm. Did y'all have any hesitations about vaccine, or was y'all?
I think for me, being, I might have been hesitant to sign up for the clinical trial, but being on the front lines, working in the hospital, seeing the numbers, seeing the ICUs, I was like, I don't want to go to work without this protection, right? There's a lot of things out there that could kill me, right? The police could kill you, all sorts of things could happen on a day-to-day, right? Taking this vaccine is one less thing off my chest, right? Going into work is one less thing I have to worry about. And it was truly a relief after I got it, was like, okay, I can go into work and not worry about catching COVID and bring it back home to, my wife, to my family. And that was the big thing for me.
Is there a stop the police from killing black people vaccine?
We still waiting on that one. It's in clinical trials right now. We're going to holler at Kizzy on that one.
Well, you said I thought it was somebody I know about. Like, wait a minute.
We're going to holler at Kizmika Corbett on that one. But no, I wanted to just quickly state, like, I had hesitation. I was one of them dudes. My dad, a black man from the 60s, and he don't believe in anything. He wouldn't pick cotton out of an aspirin bottle. Like, that's how pro-black my dad is, and he said, Tuskegee was real. He has always preached to me about the mistrust in the medical system. And I had that lingering in the back of my head as I was preparing to get the vaccine. I also was.
So when you had your arm up and you heard your daddy, like, boy, don't you take that.
Right.
Don't let that white man put that
exactly
devil fluid in your arm, boy.
That's exactly
and
what I was
hearing.
hearing.
And he was like, no, Dad. And the nurse was like, huh? She's like, nothing. Ah!
I had that exact same flashback, right? But realistically, like, I can't iterate enough. When you see it up close, when you see the devastation up close, your perspective changes. Running in rooms with, at one point, not enough PPE or protective equipment, using the same mask over and over and over again just to try to go see patients and protect yourself and loved ones. Isolating from everybody that you cared about because you were afraid that if you come home and get them infected and they actually have a bad outcome, you would feel responsible forever. Like, those things are what I was weighing. My risk-benefit analysis was a little bit different. And I think that that's a key point for people. Is like, understand what your risk-benefit analysis is. For Edwin and myself, it was a no-brainer. Like, I wanted to get back to my normal activities. And I knew that to protect myself the best way possible would be to get the shot.
How do y'all feel after having y'all?
I could jump high.
You don't get like radioactive signals and nothing like that?
Nah, just superpowers, man. My bench got a little, 2 plates, stuff like that. You know what I'm saying?
Where can barbers go to get resources related to health education?
So one, we've got our Trap Medicine website. We offer resources, information to educate barbers on best practices. Ty, you got any more?
Yeah, so off the top, I would say either you can go to Instagram, Trap Medicine. You can go to www.trapmedicine.org. We're constantly flooding information into these areas. Like, we source it, we find it out for barbers, and then we come up with our own protocols that are built on evidence that barbers can follow.
Okay. So www.trapmedicine.org. What's the Instagram?
@TrapMedicine.
Instagram is @TrapMedicine. Yeah.
On every single platform, you can go to @TrapMedicine. I guarantee you're going to see a picture of Jamil Lacey, Edwin, myself, or Brandon Turner. And these are 4 black doctors, black people who are in the medical field, literally sifting through this information and giving you the real.
That's dope to see. What do y'all feel like? How would I say this? How do you feel like that impacts young people to see 4 black doctors in that kind of in that field?
Yeah, I think that's also a big part of what this is about, is just to be present, to be visible, to show young folks that this is an option out here. These are 4 men that are doing it, and one of the things we're also focused on, we didn't talk about, is creating that pipeline. Italo's in academia, he's a Stanford attending, so that means he works at the Stanford Healthcare Center. He's involved. I've gotten involved with UC Davis admissions, and so it's one of those things where we want to see better access science programs in high school, elementary programs, so that we can get young black and brown men and women into the sciences, into healthcare, into college, pre-med, support them as pre-med, support them as medical students, and see more of them like us. And so that's really why we do it, is just to hopefully inspire future generations.
Let me give you some numbers. So of all doctors in America, about 5% are black. 5. A little less than half of that are black men.
Are we including Dr. Dre? And
if Dre, whichever doctor you want,
okay.
Sebi,
Dr. J, Dr. Dre.
Right.
There's 2 Dr. Dre's, actually.
Right, Dr.
One
Dre
was with Ed Lover.
Right.
One got headphones. These numbers is going up.
So of the medical doctors,
Dr.
about 5%.
Pepper is black, if you think about it.
If you do, yeah, I mean, technically, yeah. But we don't have enough black physicians. Obviously, the 13% of America is populated by black individuals, people who are black, indigenous, people of color, right? And you're talking about 5% of all doctors. To satisfy that, we are outnumbered. We need more people of color in the health professions. And so the narratives that we share as men in this space and the work that we do, it literally leaves a footprint, and we create that pipeline and passageway to bring others into the field.
I like it. Hey, man, the work you guys are doing is incredible. I appreciate y'all coming through. Is there anything else y'all just want to say to the people? You want to let people know how to reach y'all?
Thanks again for having us. Obviously, TRAP, trust, research, access, prevention. We want people to leave from here is, whether or not you get the vaccine, have a conversation with a healthcare provider. It's never too early to have a primary care physician. Shout out to Dr. Tyree Davey. I think he's coming on next. Primary care here in Sacramento. Tap in, establish that relationship, and we want to keep these conversations going.
For me, it's just we have to normalize health. We have to normalize wellness. In our communities, we treat it like his grandmother's couch. You can look at it and see it, but sitting on it and actually being a part of it is something that we kind of shy away from. We don't have the luxury of doing that anymore. We know that the determinants of health are out there. We know that health disparities exist. It's never been more evident than in the past year. And so as we're proactively trying to get on top of these things, we have to normalize our investment as people into healthcare and into our own wellness as a community.
Why did all black people have the same upbringing? We all know about grandma's couch. When he said it, we was all like, yeah, don't sit on that couch. If the plastic is on it and she looking at you, she waiting for you to sit on it just so she could beat you.
That's right.
It's like this is like she looking forward to beating you.
I'm glad we had the same kind of upbringing.
I'm telling you, all black people had the same. We was all remote controls.
Right.
Your mama call you from outside to get you to change the channel when she could have just got up and changed it herself.
Right.
Well, we all have the same street lights. We all have the same upbringing. Hey, man, thank y'all again, man. Appreciate y'all. Hopefully y'all, are taking this information and applying it. Do your own research. They're giving you the information. They're giving you the place to go. Now, do the research yourself and make your decisions and do what's best for you and take care of yourselves. Appreciate y'all again, man.
Hey, thank you.
Thank you.
All right, how you doing? This is Carter Todd, president of Capital City Black Nurses, back here in the world-class faders. Huge shout out to Trap Medicine. They just crushed it. I know Edwin seems nice, calm, cool, and collected, but I've seen him do some amazing things in the hospital. Those neurosurgeons are no joke. So a huge thank you to them for coming out. I forgot, I didn't really introduce myself and who we are at Capital City Black Nurses Association last time I was here. So we're a local nonprofit, local chapter here of National Black Nurses Association, which was established in 1972. We were really fortunate here, and about our early young roots, we have over 60 members. We have 8 lifetime members who do a lot of education around diabetes, professional development, obviously men's health in June. We do a cardiovascular health. We just do a whole array of projects and platforms to really lift up the Black community and develop our future leaders in nursing. So it's been a huge honor to do this work. I'm excited for this project. It's been a labor of love. I want to give a shout out to everyone who's here from Capital City Black Nurses. Esther's here helping us with surveys. Aaron King is in the background. Y'all met him. He's doing a lot of work. We have Kayleen Roseman, Makita Trainum, Dee Lucian, so many folks that put the work in to make this possible. So I know we're standing here in front of the TV, but it's really a reflection of everyone else that's been helping us along the way. So without further ado, I'm done talking about myself. I'm gonna let this man introduce himself, and we're gonna talk a little bit about what a real barber is and what that means for us here in the community. So no further ado. Your name first and your background. Of course.
My name is Dwayne Speed. Everybody knows me as D Speed the Barber. I am one of the 9 barber and stylists here at World Class Faders in Oak Park, California.
All right, D Speed the Barber. So talk to us about what the process was like to become a barber, and how did you get here to have that chair in the very front, man? That's a hot chair there.
Nah, that's a, I don't know, luck of the draw as far as that chair. But the process was, there's 2 different routes. You can go apprenticeship program, or you can go straight barber college, which typically ranges from 9 months to a year, depending on how you finish the course. I took the barber college route. Apprenticeship program lasts about 2 years. Go to school once a week. The other times you're in the barbershop cutting and getting your hours up.
Question: when you're at barber school, do they talk about hygiene, right? From a mental or a community health or healthcare standpoint, what do they touch on when it comes to cutting hair?
They touch on sanitation.
Yeah.
That is very big, and it's something that they stress. Like, even when you're taking a test, if you get to a point to where you have to figure out what to do in the next move, always go and wash your hands. Always go and sanitize. From the tools that we use, we keep it sanitized to our stations, to ourselves.
Cool. So we talked a little bit about you and your path here. Mm-hmm. What does it really mean to be a barber, right? Here in the Oak Park community, here in 40 Acres, Lonnie's done a great job with this establishment. Talk to us about what it really means to have more Black barbers and Black-owned businesses here in the local community.
Well, I come from the old school understanding of barbering. Back in the day, a barber was your counselor, your pastor, your best friend, your mama, your daddy, depending on the gender of which was cutting your hair.
Yeah.
But it's a little bit more in depth to that now, because we also are a representation of the community in which we're in. Like you said in the beginning, Lonnie has done a wonderful job opening up this shop, World Class Faders, in Oak Park, a community that is now being brought back to the light in which it has diminished from.
Yeah.
So to be here is a wonderful part and a wonderful opportunity. And along with my peers, like, we all are on the same accord. We all have this family unity.
Yeah.
So with that, our clients are now reciprocants of it. Yeah. They're able to come in and see the environment in which we're coming in, or when they come in, safe environment. We're all taking our precautions to make sure we are in that COVID-19 alignment to perform our jobs. But a lot of the times we hold roles that are very much diminished in other people's eyes, but our clients appreciate it.
Most definitely. Yeah, the barbershop is a hub of cultural influence. I didn't tell you this, but I did my research while I was at UC Davis on the barbershop and health outreach and trying to get more Black men to join the nursing profession. You think Black men in nursing, right? A lot of people might not make the connection, but for me, the mentors that I have and what it's done for my profession, it really changed the trajectory of what I was doing with my life. I was a knucklehead before. And I feel like barbering is the same thing, right? It's an avenue for someone to stand on their own 2 feet, make a solid living, and really make an impact in the community. So that's why we're excited to be here with y'all. Any shout outs? I know you got your folks here. Any shout outs for people? Any Instagram handles? Well, I know y'all are tight.
As you're saying that, I'm seeing somebody pop lock one of our barbers. First, you can follow us at World Class Faders on Instagram. My personal one is at DSP the Barber. But if you go to worldclassfaders.com, You will be able to see every single barber who works in our shop. You'll be able to see the community in which we work in, schedule an appointment, and come in and take a part of this wonderful environment we're in.
Cool. Well, I appreciate you, brother. We're going to be in and out of here.
Mm-hmm.
World Class Faders is putting up with us. We got a lot of, surveys that are taking place. We really do appreciate it. We're going to go to a short little instrumental break. DJ Soup's going to jump on the ones and twos, and hold tight, because this is where it gets really fun and innovative. We're going to kick it over to the East Coast. My brothers over there in Brooklyn, they're getting it ready. They got the whole flow, the music, the health education. So hold tight. We'll do a little bit of a music interlude, and then we'll jump over to the East Coast when we're back on.
Thank you.
DJ Soup. Gonna be super or something. DJ Soup. DJ Soup. Gonna be super or something.
What's going on, everybody? Welcome to New York. We're broadcasting right now live from Mount Vernon. We're at the Westchester Academy Barbershop. My name's Dr. Julius Johnson. I have the pleasure of being the president of the Greater New York City chapter of the Black Nursing Association. Joined over here directly next to me is a good friend of mine, Charnay, Westchester Barbershop Academy. Introduce yourself, brother. Let them know what we're doing here.
I just got a promotion. How you doing? My name is Charnay Fair. I'm the executive director and founder of Westchester Barber Academy and Westchester Barber Academy Foundation.
Good. Oh, to my right, my good brother.
Thank you. My name is Joe Reaper Pigman, registered nurse, also co-founder of Greater New York City Black Nurses Association, current historian and membership committee chair. Nice to meet you.
Absolutely. We want to shout out our counterparts over in Sacramento, Capital City, Black Nursing Association chapter, for putting this together and letting us be a part of it. We also want to shout out everybody behind the scenes that's making this happen. We got Better Angle Production that's working hard behind the set for us. We have DJ Alter Ego that's working behind here, working with us. So shout out everybody. You know, listen, it's not New York if we don't have no type of music or sound effects. So you know, let's jump into it. Shanae, let's talk about just what you do over here at Westchester Barbershop Academy. How you try to intertwine everything, and then we'll go into the purpose of having barbershop and Black men and how it just correlates with everything you do.
Sure. So Westchester Barber Academy consists of 4 tiers. One, we have site contracts where we go to places where people are confined to a space for whatever reason, and we implement our services in one of 2 ways. One, we would teach an intro to barbering course. So 2 of our biggest clients are Rikers Island and ACS, one of the juvenile detention facilities and a correctional facility. So we'll show them how to cut hair. We'll give them an intro to barbering class so that when they come home or come out of their situation, they have something to pursue after they're done. The other way is that the way that we implement our services is that we would deploy a team of barbers to cut about 30 people in the nursing home, juvenile detention facility, some high school programs, you name it. So that's the site contracts. Then we have the barbershop. Pretty self-explanatory how the barbershop works, but this really is just our community space. It functions the normal way a barbershop would, but we also do different health initiatives. Sometimes we network our customers. If someone is, into real estate or does financial literacy, when the shop is crowded, we'll let someone take control of the TV and kind of present to everyone in the barbershop. So right next door to our barbershop, we have the barber school. This is for everyone who's an aspiring barber going through the someone to know how to turn a pair of clippers on and off. They learn the skilled trade of barbering. We get them licensed, and then if they prove themselves to be an outstanding student, they could always work at one of our sites. Since we have one of them about to grow to 17 over the summer, we're always looking for barbers, contract barbers, and contract barber instructors. So when it's all said and done, we teach them a skilled trade. They take the test to get licensed at our facility, and then they can work with us. So the question that everyone's always asking, even when we were in high school, college, professor, can I really get a job from all of this? Right. So that's the. And then lastly, the foundation, which is our nonprofit 501c3, is for our community outreach. Last year, we won a grant with Public Health Solutions and the Department of Mental Health and Hygiene, where we adopted 6 barbershops and trained the barbers to be health ambassadors on the topic of HIV prevention. In return, the barbers trained their customers on HIV prevention, and we simultaneously matched up each barbershop with a local clinic so that people could get free and anonymous HIV testing.
And you know what? Since you said it, let's elaborate on that part right there.
Sure.
On HIV prevention.
Yeah.
How was that received when you started educating the other barbers? How did they receive it, and did you receive any feedback on what they of when they were talking to their customers?
So anything that you talk about in the barbershop is fair game. They say that you shouldn't talk about sports, politics, religion. All of that happens in the barbershop. So when we talk about different things, as you know, your barber, your relationship with your barber is that of a confidant. They're your job counselor, your marriage counselor, relationship counselor, your fashion consultant, your therapist, everything, you name it. So I find that people are more open to discussions in the barbershop, especially after, they're stressed about something, put the hot towel on them, all of a sudden they're all ears. But, the things that we don't talk about in our community, we can talk about in the barbershop. They call it the Black Man's Country Club. So everything happens there. But I think that people are more open to the information that they receive, because for some people, the people that pastors, politicians, doctors in some cases, they won't listen to those folks, but they'll listen to their barber.
Absolutely. And it's so interesting because I'll have conversations with other family and friends, and then just people that you know in the street, and like just with the HIV prevention conversation, right? Like we'll talk about, I'll tell them there's a medication you could take once a day, every day, and it will 99.9% guarantee you cannot contract HIV. And they'll look at me and like, no, that's not true. Like, what are you talking about? I'm like, no, it is true. And you're a doctor. Right? But we don't talk about it enough. Yeah. So it's interesting to hear that that's being talked about in the barbershop. And what we're also going to do, so we have a couple of people that help put this together. We also have another expert, Dr. Jadan. He's going to come over and join us. Come in, brother. Come in. Welcome. Good seeing you. Yes, please introduce yourself to the people. Let them know what you do.
All right. Well, good afternoon, everyone. My name is Dr. Jadan Phillips. I am a family doctor by trade. I'm actually also the Associate Dean of Student and Minority Affairs at Stony Brook Medical School. I am a proud member of the Omega Psi Phi fraternity and part of our Health and Wellness Committee, both on the district and an international level, and part of our COVID-19 task force. But more importantly, a Black man that came from a community where we didn't have great health resources. So I've always been one that's promoted and talked about how we need to be more proactive about our health, because we have seen that we've been very vulnerable to this pandemic. And a lot of it has been because we've taken a much more reactive approach as opposed to being proactive with our wellness, making us vulnerable to COVID.
Absolutely. And let's tie in those 2 points of us being proactive, us being sharing more information, and then the barbershop, and us being in New York City and being the state of New York being the epicenter of this pandemic, right? And what was that effect when the barbershops closed down? If this is where we go to get all of that conversation that we have going, all this education. What was the effect on your end? Because we had to completely shut down before everybody else did. Yeah. Right. So talk to us about the effect you saw, Charnay, from just being a barber, and then Dr. Phillips, talk to us about the side of what you were seeing with your patients and them not being able to get that piece from the barbershop.
You know, when we first shut down for 3 months, you know, and we were getting calls, hey, I need to cut everything. So our stock definitely went up in terms of being an essential part of the community. For some of the people that were saying stay home, and rightfully so, when they were on TV, they were very well groomed. So somebody was actually taking care of them. But I'll tell you, I mean, just having a place of where we disseminate information in the barbershop is directly linked to people's self-esteem. In this business, we sell self-esteem. So quick story. One of the things that we used to do as barbers in the 1800s was when someone was sick, the first thing that they would do is get a haircut, because that was believed to jumpstart their self-esteem and get them on the road to recovery. So real quick, a lot of times people look at the barber pole and don't necessarily know what that symbolizes. And during the 1800s, barbers actually did bloodletting. They pulled teeth and operated in a dental capacity. So we're always sanitary. But to answer your question, you know, it was like everyone was isolated within the confines of their own house when we had a shutdown. So there was no dissemination of information. There was really, you were stuck in your situation. You know, socially, that was shut down. Everything was restricted to a Zoom call or Google Meet, whatever. But yeah, it was just a bad time.
Yeah, I would add on to that. Again, one of the biggest things that we saw then was just the misinformation. And getting back to the critical nature or the critical role that the barbershop plays, you know, I remember back in January and February of 2020, hearing folks say, Black folks don't get COVID. What you talking about? You know, so again, how many people made moves, decisions based on that misinformation? Another thing that we had, say I come to the hospital. I'm not sick enough to be, because I think we had a unique experience in New York being the epicenter, getting shut down in the beginning. And you had individuals that came to the hospital, and because it was so heavy here, the hospitals were overrun. So they only could deal with the most serious stuff. So what happens is, you know what, my man, you ain't really sick enough. You go back home, and if you get sicker, come back. Nobody's saying to you, you need to make sure that you mask. This is how you do it in an apartment where you live with your kids and maybe your parents. And again, because of that intergenerational existence that we have, and then a lot of us fall into the got-tos. I got to take the public to work. I got to take the train. I got to take the bus. I can't Zoom work. So with that, how do you educate or teach a person how to be safe when they got all those got-tos on their life? And as we are using right now, we got to take advantage of our barbershops. I think the reasons that we've been vulnerable from this pandemic have been way before, you know, the pandemic. And a lot of it is preventable. You look at many of the illnesses that make us susceptible, heart disease, diabetes, obesity, all of these things can be preventable. And where do we get the information on how to get prevention out there? The barbershop. And with them being closed, unless you had a link, you wasn't going to be the one that was going to be sexy. You were going to be wolfing, you know, and along with wolfing came with, I don't know. And now that we're into the time of the vaccine, which, again, if we weren't vaccinated, we wouldn't be sitting there like this. Right. And how do we reach those individuals that are still reluctant, rightfully so, because America ain't treated the black man right. Yep. So the black man's got right to be, you know, skeptical, to be suspicious. However, that's what COVID is looking for. Mm-hmm. And today, burying a cousin, you know, he wasn't vaccinated, died of COVID, 53 years old, 3 kids, you know, so thank you, bro. But, you know, with that, you know, how do we reach those individuals that are rightfully, man, I ain't messing with that. The barbershop, because they come in there. I mean, I still remember, still got jokes that we've heard in the barbershop when I was a teenager, because I remember my boy might be watching now. I was getting my first fade, and the barber we had, her name was Linda, and she had jokes all the time. She said, "You want to fade?" So throughout our life, that's the recurring joke. But that speaks to the essential role that the barbershop plays. And I think it's important that we make sure we utilize that, because these folks have been trying to communicate to us using their means of communication. And what has happened? We have not shown any improvement as we've gone into this pandemic. Of the 580, maybe 600,000 people that have died, 45% of them are people of color. We only make 11% of the population. So that means that we got too much of the weight. And why do we have too much of the weight? We got to do things to change it. And part of changing it is making sure that we educate. And part of that educational process is using faces that people can trust and language that is understandable to us. Because, again, all respect to Dr. Fauci, but Dr. Fauci, come on 3rd Street right now, ain't nobody hearing Dr. Fauci. You know, real talk. So right. I think that we've got to take advantage of the trust that we've developed, the trust that this institution has developed, not just in this community, but all over the country, because you can go get a cut anywhere and a good barbershop feel the same wherever you at.
Mm-hmm. And I'll tell you, you know, when it comes to a barber's platform in the community, like this is the only place where you can have a pastor, a drug dealer, you know, a corporate guy, all in the same room, and everybody gets along. So when you can't underestimate your platform as a barber, like you literally can squash beef in the hood. Mm-hmm. You talking people's marital problems out, their job problems, asking them, you know, if they come in and they're going to a wedding, what's your weekend looking like? I'm going to a wedding. Mm-hmm. You're their fashion consultant. So a lot of times you're unofficially woven in the fabric of their family.
Not to cut and to follow off of that, the things that barbers communicate to their clients and the community members, they're going to go out and communicate that same information.
Absolutely.
So now that we're investing more into our barbers, which is what we're looking to do, having that information, having the right information, knowing what resources they need, and knowing where to go to get certain things, that's important too. Because like for myself, I was working in the pandemic, in the ICUs, you know. And I would go into my community building, and I have neighbors that are older and they can't go out. So I would have to go and help them with their medications and grocery shop for them. But at the same time, teach them about medicine. They don't know what an A1C is, or they have a device to check their blood glucose every day, but don't even know how to use it. Scared to ask questions because you don't want to ask a doctor a question because it's a doctor. How could you question a doctor? You know? But then you have your barber, someone that you're comfortable with that has this information that you could trust. We need to utilize that more, and like Dr. Phillips was saying, really take advantage of that space.
Yeah, I think also there's a misperception in our community, like if it's going on, I don't want to know. You're gonna find out anyway, one way or another. So don't think that you receive negative information from the doctor or something like that. That that's an omen. You rather find that out. You rather find out negative information and have some time to react to it, to still put in some practices before it's too late.
And I think one of the keys to why barbershops are so well received, when you take the example you just gave about a drug dealer, a doctor, a business person, somebody who has a regular 9 to 5, all in the same room. At the barbershop, we all have equal voices, right? We all get to yell and argue, whether it's about LeBron, whether it's about a new medication that's coming out. We all have equal voices. Too many times in a healthcare setting, they're on our territory, meaning you go into a hospital, you're on the doctor's territory. Absolutely. Right? You're in the nurse's territory, right? And one of the things, so I specialize in home-based primary care. And one of the things I love about it is that I'm in a patient's territory, right? I'm in your home. And a lot of people, a lot of healthcare providers who can't make it, can't understand that they have to give away the power that you receive in a hospital. Right. So I'm like, I love it because I get to see how this person really is. And they must, right? Like,
they're honest.
Like, forget all of the yes, you do in a hospital. Right. Like you get to, are you really taking your medications? How do you really feel about the system? And the barbershop is like that. And if we can find a way to transform healthcare for Black men into what it's like in a barbershop, we will improve the lives of Black men by empowering them, giving them information. All of these things I think is absolutely necessary.
Yeah, I think, when it comes to, and Dr. Phillips said it earlier, there's a lot of mistrust in our community, right? So let's not focus on who we don't trust. Let's focus on who we do trust.
Yes.
And kind of surround ourselves with those folks.
Yes, and we have to acknowledge why it is mistrust. As Dr. Phillips, myself, Josie, we're supposed to be the bridge, right? So we're the bridge, meaning we're Black men. So we've come from family members who have had ill fortunes from healthcare, right? You want to go to the Tuskegee experiment, you want to go to being disproportionately locked up, to living in food deserts, however you want to do it, we come from that. But we've also crossed over now into becoming healthcare providers where we provide these things. So trying to provide a bridge and trying to figure out ways. And that bridge starts with acknowledging a mistrust.
Absolutely.
Like I tell people when I talk, I give a COVID vaccine conversation once or twice a week. And I always tell all the Black people I talk to, if you say, all right, cool, I'm down to get this COVID vaccine, I'm gonna think you lying to me, right? Just because I know what you've been through and I know you might just be trying to shut me up. Right. So tell me the truth. Let's acknowledge it. I'll tell you where we messed up in the healthcare industry. And I'll tell you the steps that we're trying to build to get over it, right? Like with the Tuskegee experiment, one of the biggest things we did wrong as healthcare providers is we took away people's choice, right? And you can't do that in any healthcare situation. The choice of being in an experiment of not or not, right? So we worked hard to give everybody back choice after that.
No, I think it's, you guys are spot on. I think, again, it's respect. I know for me, like when I'm seeing patients, I sit lower than everybody in the room. Just because I know me standing over you, I know right now I'm the type, son, why you standing all up on me? Like, so for me, I think, that is one thing. Another thing is I don't use big words. I mean, unless you want me to, and I can do that. But, I understand sometimes because of the respect that people have for the medical profession historically, I don't want to bother the doctor. look, a visit to me can cost your insurance company $200, $250. If we went out to dinner and spent $250 on a meal, would you tolerate not having clean silverware? No. Would you tolerate not having your water filled up regularly? No. So why are you going to allow me to not answer all your questions? I think the other thing to take into consideration to make sure you maximize your interaction with a medical professional is prepare for it. They had a commercial a few years back. It was a brother who was in this bathroom practicing on how he was going to ask his doctor for Viagra. So he was like, can I get Viagra? Do you think I could get some medicine? You know, all of these different ways. But I think the bigger message from it was the stage fright that people sometimes have. And then what happens if you go there and your wife gave you all these questions, you don't get the questions asked, you come home, she's like, yo, did you ask about when you should get your colonoscopy? Right. And she's looking at you crazy. So with that, you got to prepare for the interaction. You got to write your questions down. If you get shook and you need somebody with you, I'm good with that too. You know, sometimes, you know, as a healthcare provider, you want everything to go smooth, but as a black man, if I'm not speaking up, let me have the bulldog with me who's going to say, yo, hold up. You know, because I think that the important thing is making sure you get what you're supposed to get from that interaction, not to make me feel like Dr. Phillips. You know, forget me. You know, make sure you get what you need. And part of that, again, like you said, you've got to take into consideration the experience that black men have in America. You know, January 6th didn't help us trust in medicine because even though it didn't have anything to do with medicine, but I know if we rolled up on the Capitol the way we look right now, we wouldn't be getting out of there or dealing in the way that those folks are dealing with.
We wouldn't be having this conversation.
Absolutely. We'd be in jail having this conversation. Or dead. Or shot. We wouldn't be in there saying, I want organic food and lock up like main man was. But I think when we laugh, other brothers that notice that are like, that's why I don't go to the doctor. You see that stuff there? Yeah. You know, why am I going to trust that man to give me medication? I remember going to the conclave. It was in Vegas, and I'm standing there, and one of the brothers, because I'm one of those guys within the fraternity, everybody will call me, even outside of fraternity, my friends, yo, I got a medical question for you. So one of the brothers, he was from Kentucky, he was like, yo, man, this bro over here had a medical question. Would you answer it for you? I said, what's up? He says, man, I got this white doctor. He told me that I got high blood pressure. I said, well, how high is your blood pressure? He said it was 170 over 1. I said, yo, you got to listen to that white man. He ain't telling you no lies. At that point, he was like, okay, I'm good. But again, it speaks to the mistrust that we have. And all of these little efforts, when you go to the homes and showing respect to the crib, me getting lower, using language, you helping, you setting up these conversations, all of these things make us feel better because at the end of the day, your health don't care about your excuses and neither does COVID.
Yeah, absolutely.
And I'm sorry. And on another note, right, in terms of our planning and having a will, and, you know, we're reactive on a lot of different fronts. So now you take that same person who did not want to go get vaccinated, didn't want to monitor their high blood pressure, then all of a sudden they suddenly pass, no will, no estate planning or anything, and people telling chitlin dinners to try to bury you in church.
Or had a will and never expressed that to the family because we don't have those conversations in our household.
And that's a good point to where I want to pivot, because I want to pivot into mental health and the stigma that comes behind it, especially for Black men.
Yeah.
And I'm gonna start with this people passing suddenly, especially from COVID. So my barbershop, Duckett's Barbershop in Brooklyn, New York on Notion Ave, which has been there since, God, I think like the 70s, right? 70s, 80s. He died from COVID, right? Meaning when New York got the order to shut down, right? They was like, oh, New York is shutting down, you got one more week. The next week after that, he died, right? And it was one of those where it was like, one, where are we going to go from now, right? But also, you think about like the mental health aspect, because we came to find out that he didn't need the barbershop. Because a lot of times I would go in there and I would always wonder, how is the shop still open? Right? Like I would wonder, just because it's like, you know, the people from the neighborhood still come in, they put up a brand new shiny barbershop across the street with all the new gadgets, right? And a lot of times I'm like, Duckett and Marlon are the two main ones here, but there's like 6 chairs. And came to find out was that he had a bunch of investments.
Yep.
Right? And he owned the entire building.
Yep.
Right? Like, and this is Crown Heights, Brooklyn prime real estate.
Yeah.
Right? So the barbershop was his mental health escape.
Right.
Right? Like he was able to come in, like get away from family and just have this mental health space. Mm-hmm. Right? So you talk about us losing a barbershop during COVID, and it just, we already have a stigma as Black men when it comes to mental health. So I just want everybody to talk about how we view mental health, how the barbershop may help us get through it, right? And destigmatizing mental health and seeing the psychologist or different ways that we do therapy.
You know, my mom was mentally ill. You know, my mom, I grew up with my mom being schizophrenic. And, you know, I think a lot of times the Black church plays an important role in our community, right? And a lot of times we think we can pray certain things away. You can't pray away mental health. I mean, mental issues, you know? So for me, growing up, my mom had kind of 2 different personalities, and that was kind of normal for me, you know? And since she's taken her medication, there's been a long stretch where she was normal, and I didn't necessarily know how to respond to it and kind of adapt to it. But just coming from that place, you know, I think a lot of times we think certain things will work themselves out. There's things that you can't work out. There's things that you need help with. And going back to what Dr. Phillips was saying, you know, you can't, our community and as a whole, we're reactive. We tend to be reactive instead of proactive. Like we tend to treat our issues like some of us treat our cars. You know, you don't get your oil checked, you don't get your tires rotated or switched out. But when you break down on the side of the highway, you're calling everybody like, you got to come get me.
Nah, I mean, you know, I remember growing up, and one of the illest t-shirts I remember growing up was a shirt called "The Heart Is Hard," and it just sort of typified what I viewed at New York at that time. Yeah. And then you remember guys in the, you know, every hero in the movie was the strong, silent type. So there were all these examples of not expressing yourself. And then you combine that with the daily frustrations of being a Black American. You know, it don't always have to do with somebody saying you're anxious or depressed. It could be, you know, the fact that you got dissed at the store. If you know, the police pulled you over, all of these other things, or you don't get the opportunity or job that you're deserving of. So all of these other things play a role, but we've not been conditioned with the whole activity of talking about how we feel. You know, so a lot of times when you see us get emotional, it's an explosion because we go from 0 to 120 in 5 seconds, but it's not that. Look at Kwame Brown. Kwame Brown been sitting back chilling for years, and it was one time too many. And he was like, nah, son, I'm not having this no more. And think about on a more daily and local level, how that can happen to somebody. So I think, again, you know, with these athletes talking about that, you know, the sister in France saying, I don't want to participate in that because I'm not feeling well. I think that that transparency, like for me, I lost a son to cancer. And if I did not go see a counselor, I would have been different. You know, I would not have had that experience make me stronger. It would have made me weaker. And I started doing yoga and I started going to see a counselor because I didn't have any other means of really trying to boost my emotion. You know, because I was in such what I felt to be a horrible situation. But again, on the other side of that now, I can talk about my son's death as something that made me stronger. And part of that was having to sort of experiment with things that I wasn't comfortable with. You know, I would pull, you know, I'm in the medical field. I'd go talk to my father or talk to my mother, and they still of the old school way where, what do you want me to say? So I couldn't even go to them as I would have liked to. I went and saw a counselor. But I recommend counseling for anybody, take advantage of that because it helps to talk to somebody. I mean, that's what a barbershop in a sense is a counselor. Absolutely. It helps to talk to somebody that isn't in your house, isn't in your space that you may respect about how you feeling, because it's not fun figuring out under the moment of stress, like, what do I need to do right now? Because a lot of times we don't get the opportunity to make a mistake out there. You see how they handle us. We don't get the, hey, like the two little kids that shot up at the Bonnie and Clyde in Florida, the two white kids. If those were two black kids, they would have got shot with, they would have got shot up in holes like Swiss cheese, and that's what, unfortunately, we don't get 3 strikes. We get 1 strike. So that's why, as you said, we've got to stay really proactive about this because, again, we could talk about the physical health, but the mental health is just as key. And it's been shown that individuals that are depressed, obesity, heart disease, diabetes, stroke, all of those things can run sort of in the same groove with them. So we've got to be, just like we address the physical things, we got to make sure we're intentional about that as well. And brothers, especially brothers that know people, that people respect, hearing them say, yo, I went to see a counselor. Yo, I'm depressed. Yo, I'm anxious. Yo, that helps other people because other people like, yo, son, I know before you said that, I would have been like, what am I going to do with this? So I think definitely it's critical because being a black man in America is rough, and it don't, a lot of times, it's funny, I've gone to school with white people, and I remember being in medical school in '92 when Rodney King was happening. And when nobody talking about Rodney King while I was walking in the classroom, I mean, the only way that I survived without punching somebody in the face was hip hop was real good back then. So I had my headphones on as I went from classroom to classroom because we didn't have any sessions to talk about, well, how you feeling with what's happening with Rodney King? So again, just use that as an example of we don't readily have these spaces where somebody's like, yo, you good? So we've got to create those spaces because unfortunately, as we see Rodney King, Breonna Taylor, George Floyd, Joe Black that lives on 3rd Street, it could happen on any level. And it's still, even though it may not be us or somebody we know, it still affects us. I felt George Floyd. I'm sure all of y'all felt him, So I think that we've got to be considerate as medical professionals of how the American experience impacts men of color and how they care for themselves from a mental health standpoint, but also from a physical health standpoint.
Absolutely.
I was going to say, and being intentional about the experiences that we have growing up and how our grandparents and parents raised us, and opening up that space in our homes to allow our sons to express themselves and our daughters to express themselves. Because if we not speak in the house, we just going to continue the same cycle.
Yeah, absolutely.
You know what I'm saying?
I'm sorry. And a lot of times we have the antidote to whatever our poison is. We just choose to suffer in silence. A lot of the issues that happen in our community, from, you name it, stop snitching, which is destroying our community. We have the opportunity to do something within our own confines. Whatever is in your reach, people think that you have to be on a certain level to reach back and give back. Do whatever is within your reach, which is whatever is in your grasp.
And going on that topic of not realizing that sometimes you have the power to do it, and touching on George Floyd, right? So George Floyd, it happens, right? And I remember just being frustrated and furious for a while because I'm a black man in a profession predominantly dominated by white women, right? So I constantly have to be cognizant that I can't talk too loud.
Can't be angry.
I can't yell. I can't show anger, right? Because I'm around women and then I'm around white women, right? And as a descendant from slavery, you know how that can go sometimes, right? Down to even as little black boys, right? And George Floyd's happened and I'm so angry. And I'm like, yo, I have to do something, right? Like I have to do something. Like I get that, yeah, cool. I'm a nurse practitioner. I have a doctorate, but I need to do something, right? And Josie calls me with a couple other people from the chapter, and they're like, we need to do something as a chapter, right? Like I don't care what, we need to do something. I'm like, yeah, let's protest. And he's like, all right, let's do it. We call a board. We get the board on the phone. Listen, we gonna put everybody in white coats and we gonna go walk, yell, scream for George Floyd and say his name with Breonna Taylor and with everybody else, but we gonna do it in white coats and scrubs so they know that Black people are taking care of them. These heroes that you just held up high and self-esteem, I mean, in such high esteem, we're also the people that we look just like the people that y'all killing in the streets, right? Because we've all been pulled over and had these things happen. So we start protesting, we start marching, and all of a sudden, conversation gets a lot different, right? In terms of, oh, you know, there's thugs that's protesting. Now we come across the Manhattan Bridge 900 deep in white coats and scrubs, and it's
stethoscopes.
You know, those are the heroes we just upheld, right? But it was one of those, we wasn't thinking that we can do anything, because a lot of times we're saying, yo, we're just healthcare heroes. We can't do nothing in social justice, but it plays a role.
And man, you hit on so many good points. You know, the African American dollar is, last time I checked, number 7, and the other 6 are countries, entire countries. So when you add up our spending power, like the way that you affect change is to hit people in the pockets. You know, that's what made the civil rights movement so significant. You know, it was this cry that we were going to march, but then we were letting y'all know that there's going to be a financial boycott. Y'all going to feel it. So when it comes to our spending power, if we are united in our spending or the lack thereof, we get people's attention. So for when it comes to, and we need to hold everybody responsible. At this point, if you are not on the side of equality or equity, let's use that word. If you're not on the side of equity, then we automatically got to consider you to be on the other side.
Oh, absolutely. And it's especially if it's going to benefit our mental health. Like when Dr. Phillips was talking about Naomi Osaka, at first she was like, you know what? I take it fine. I'm not talking to the media.
Yeah.
And then she went, oh, you're going to ban me? I tell you what, I do you one better. I leave. Right? And when you start knowing your worth and you start understanding that you can get comfortable and not have to deal with certain things, and you start being like, you know what? Do it yourself. Right? Because everybody that was criticizing her, she pretty much told them, oh, you have a comment?
Make another hole.
Right? Like, yeah, you come hit this tennis ball. Right? And then she got up and left. And I think it's, what time is it? 3:42? I think we only got like 2-3 more minutes before we wrap up. But I do know so we'll be back live again from 4:30 to 5. And at that point, we also gonna take a lot of questions from people that's getting their hair cut in the barbershop. We're gonna talk about, because Dr. Phillips been hitting it home in terms of we need to do more funding for barbershops in terms of healthcare, right? So we need to talk about how we can do that and some of the ideas and how we can push that as Black men and why it's so important to us. And I think we're cutting out. I guess you get some sound effects. I want some music. I want some music. All right, you might as well play something. They're gonna show.
Christian Jacobs. Appreciate you coming through, Christian. Can you tell the people who you are and what it is that you do?
Sure. As you said, my name is Christian Jacobs, and I'm basically, I work in the mental health field as a mental health clinician. I also work as a health equity advisor, behavioral health consultant, really working with community business organizations such as Brother Be Well, as I'll talk about a little bit about more, as a clinician and advisor. Really helping the youth out in terms of mentoring, mental health mentoring and youth and development. Also partner and collaborate with state agencies as well, such as California Department of Public Health, Criminal Justice, California, also working with mental health agencies just to really partnership and work in terms of developing health equity measures and standards. So there's a lot of health equity disparities within the medical system. So especially now, we're really working to identify some of those mental health equity challenges that lie within the system to kind of work those out and see how they can be alignment within laws and different new things that are coming through the administration right now. That's just a little bit of what I do.
That was a lot of what you do. That was a lot of information, but it's good information. How long have you been doing this?
I've been in the mental health field. You know, they always say that, you know, you were probably doing something before you really got into it already. If you really want to know what you want to do, you're probably already doing it. So I've been, you know, really an advocate for mental health and men of color for about 20 years now. I really started working in the school sector, working with SED youth, and they're changing that term. That's socially, emotionally disturbed youth. But they're now changing that term because they don't want to identify a youth as socially, severely emotionally disturbed. So that was really my start, and then I started working my way through. It was actually lived experience that really got me into mental health, though. Living in Valley High, growing up in the Valley High area.
Yeah.
Yeah, in that time in the 90s and 2000s, sometimes we just really discounted some of the traumas that we experienced as young black men. So that was really my first go at really seeing my own trauma through loss, losing my mother, through a traumatic experience, also losing close friends, through violence and murders, things of that sort. That was really the beginning of not really noticing how much trauma, impacts black men and men of youth. So that was really the genesis of it. And then really moving on down life, saying that, I'd rather use my life experience to help others and help other youth, and it's really giving back in a way that I wish I had. When I was growing up, I wish I had someone there who was, could guide me mentally in terms of what was going on, how that trauma impacted my love life, my social life, my relational life, things of that sort. So now I have the opportunity to really give back to the youth as a clinician, a mental health clinician, to show what are the detriments and the social determinants of impact and impact of ACEs, which is adverse childhood experiences. So what are some of those adverse experiences that you that happen in your youth that we kind of brush off, right? Sometimes we brush off a lot of the issues that occur, like, for example, something as small as, I'll give you an example. In class, someone, booed you at the talent show. But for the next 10 years, you're going to have a fear and a phobia of going up on stage. But we kind of brush that off, right? But that can turn into an adverse childhood experience where now you have a fear of maybe public speaking. And that public speaking issue could then develop and turn to something else and can exacerbate. So these are some of the small things now that within California that Dr. Nadine Burks is looking at in terms of ACEs, in terms of how those small adverse childhood experiences, that toxic stress that we deal with as youth, how it kind of formulates our life moving down the road in our mental health capacity.
I remember I was in school and I went to get my free lunch, and for some reason, my card didn't go through on the free lunch. And I was traumatized. I was scared to use my debit card in real life because I remember not being able to get the school free pizza. ACEs.
Exactly. See, and most of the time people would look at that, right? And they're like, oh, that's not a big deal. But how can that affect you down the road? Now you may be afraid, to talk about your financial status, right? You may be afraid to, go to school and maybe show, how you get lunch, or in turn, you may be afraid to eat it all. So what happens? That child, you at that time, goes without food and sits in class, right? And so now you don't have the food and the nourishment to participate in class. So there's several structural and institutional issues why, certain individuals in school act and react the way they do. It's not just a behavioral issue in class. It's not just the child is acting out or they have ADHD or they're oppositional defiant. There's other underlying issues, like the example you just gave, why a child may not be participating inappropriately in class in terms of behavioral issues.
That's deep. Eat, children. eat your food. So what about, okay, this is the question. Historically, we're talking about historical. Do you feel like black men suffer from mental health conditions more than other races or even women?
That's an interesting question, because statistically, number-wise, when you look at the numbers, right? Statistically, it shows that African American men do not suffer in terms of number-wise any more significantly than your white counterparts or any other group. However, and that's only because there's several determinants, and I can kind of get into that. However, there are several other institutional things that impact black men that really, in turn, affect mental health. I'll give you an example. We have social determinants, right? So there's several, right now, what's going on. So in terms of the media, so we have institutional racism. We have structural racism. We have implicit bias. These implicit biases affect black men at an exorbitant rate more than their white counterparts and female counterparts. So numbers-wise, you look at the paper, right, and you look at the National Institute of Health and say, oh, yeah, well, the numbers show that, black men don't suffer in terms statistically as much as your white counterparts. However, what we go through on a day-to-day basis, and in turn, we do have a higher number of issues in terms of mental health. Another issue can be this too. So you're looking at mental health in terms of how does it impact the individual, right? So when you have a person who's basically they've been traumatized, they're afraid to come out, and they're afraid to. Sort of statistics come from hospitals and numbers. So if someone's afraid to go to the hospital, that person's not going to be counted in terms of what they're experiencing. And B, you're talking about stigma as well. So we have the stigma in terms of in the Black community with mental health. So if you have an individual that doesn't want to either self-report or be treated due to their distrust in the medical system or due to the stigma of going to get help, then those numbers aren't going to be recorded. Another issue is that you're looking at how the numbers are traced. So many of the numbers come out, and then we try and report back and see how that impacts the Black community. Another positive is that the Black community also relies on religion a lot in terms of that. That's a lot of our sources in terms of mental health, and as we're talking now, barbershops, things of that sort. So we use alternate avenues of mental health other than just going to a clinic in the office, which in turn those statistics and those numbers aren't necessarily recorded. So number-wise, it looks like, oh yeah, it may be equal or the same, but in terms of how it impacts us is very different. So the short answer is no. We don't suffer in the same manner. We suffer at a higher rate because a lot of our issues are unreported. Black men are overdiagnosed, misdiagnosed, over-medicated in terms of our youth. Foster youth are over-medicated. The foster youth have are overrepresentation of basically being drugged and using psychotropic drugs that may not be necessary or may not be appropriate due to, as I explained earlier, a child may be sitting in class, they may be malnourished, they may not be getting the food they need, but a teacher who's not culturally competent and doesn't understand the cultural barriers that child experiences, what happens is they send them to the office instead of having some type of social emotional learning component within schools to say, okay, what's going on in this child's home? Did you eat today? Did you have breakfast this morning? What's going on in the home? What are your social barriers? What are your emotional barriers? And then give them the proper tools and treatment, whether that's an IEP program or things of that sort, to give them what they need.
Yeah. Because one of the things you said is like, Black man, we do a lot of our talking in like the barbershops.
Right.
I wonder, do white people talk in barbershops?
That's a good question.
Is it like a round table at Supercuts where they get things off their chest?
That's a good question. They have the TVs there, and I'm for sure they have the TV and the sports going on in Supercuts.
Are there deep conversations going on in great clips? Does anybody have these answers? I'm gonna go to a white barbershop just to see what they be talking about.
Just to test it out.
Just to see if they own what we are. What would you say some of the barriers are within our community when it comes to mental health?
You know, unfortunately,
and the as far as the resources.
Unfortunately, there's a significant number of barriers that exist. First is a lack of understanding of the mental health delivery system. Even as someone who is educated in the mental health system, someone who may be a therapist or a psychologist, a psychiatrist, it can be confusing to them. If the average person who's in the medical field wants to get help and they reach out to their medical provider for help, it can be confusing for them. So imagine how that is for someone who's totally oblivious to the medical system and the mental health delivery system, of how confusing it is. It's very confusing. There's several changes that are going on currently to work out some of those issues in terms of racial disparities. But that is initially one of the main issues. So you're looking at first you see or you recognize that you have a mental health condition. Next, you want to get help. You don't know. Many individuals don't know who to call, who to speak to, where to go. And then when that provider gives you a phone number, they'll give you a list of providers, and majority of the time, 10 out of 10 of those providers are full or booked. So then there's frustration. So here you are, you're dealing with a mental health condition, and now you're frustrated with the system. So there's two components going on there. Another barrier is also cost. So you're looking at cost. So there's sometimes there's an out-of-pocket expense. So you may have Medi-Cal or Medicare. You may be covered through your insurance, but there may be an out-of-cost expense in terms of having to pay out of pocket that may be costly to some individuals. Whether that's a $25 copay or $50 copay, things of that sort. So now you have costs, and now you have confusion in the system. And then actually, what I should have said first was stigma. Stigma is the number one issue that can be that's a barrier in terms of the Black community because, as I said before, one of the positives in the Black community is we're built on resilience. So we're built on, through historical dehumanization of the Black community, we've built our resilience, whether that's through slavery or different civil rights eras that we've experienced. We're a resilient folk. We're a resilient people. However, on the flip side of that, that resilience sometimes makes you say, I don't need this. I can deal with it on my own. I can, go to my boy and talk my problems out.
The barbershop.
Or the barbershop, which is, it's good, and now we're, with these events here, we're training individuals in the barbershop how to be that ear, right? Potentially putting mental health first aid in the barbershop. So those so they're not necessarily mental health clinicians, but they have that ear to hear some of those triggers, what can be, suicidal ideation. Is this person talking to me? Are they, do they have any ideation in terms of suicide? Are they talking about, hopelessness? And, so they at least have the ear to be able to pick up on certain things and maybe get them the right help, hand them a brochure, something small like that in that sense. So those are some of the main barriers that exist in the community. And one of the other ones I want to talk about too, in terms of one of the largest barriers, is you're looking at individuals who really, once they get the grasp of where to go, now you're talking about a therapist who don't understand you. So now you're sitting in a room, you finally get one, right? You go through all this trouble. You go through all this work to finally get a therapist, and now you're sitting in a room with someone who doesn't understand where you come from, your history, or your background. Yeah. So now we're talking about cultural competency. So now we're going to find one of the barriers is having enough cultural competent therapists in those clinics to be able to help out and say and understand their biopsychosocial assessment of where they come from.
Yeah, that's interesting. It's very interesting. You touched on it earlier, but talk about your work with the Brother Be Well program.
So Brother Be Well it's a great work that's going on. Brother Be Well is a nonprofit organization that really supports Black men and youth of color, ages 13 and up. And these individuals work within the underserved communities. So that's the African American, Asian Pacific Islander, Native American, LGBTQIA plus community. I know I'm forgetting one, Latinx community. And these youth basically are, I'm working there really as a clinician and a clinical advisor to really develop a lot of the programs, virtual programs. There's a virtual community. And you can go on brotherbewell.com as well to find out a lot of this information. There'll be a launch this summer, 2021, on their website that really will provide a lot of the youth chats. So I work with them in collaboration to really develop youth chats. So it'll be a peer-to-peer and a peer-to-clinician. So a lot of the peers ask questions to the clinicians, such as myself, on mental health, depression, relationships, mental health and nutrition, things of that sort. Also, there's a podcast. There's very frequent podcasts that come out on different topics and different segments. So that's really the work that happens within Brother Be Well. This work really does focus on those underserved communities of the BMOC, which is the Black men and Black youth of color.
Black men and Black youth of color,
yes.
BMOC.
Yeah.
I like it. What would you like people to take away from this event? Or what's one thing you want people to take away from this event as a whole?
Mm-hmm. Well, I think mainly what I think will be good to take just on a mental health perspective is that majority of individuals will deal with a mental health issue sometime in their life. One of the main stigmas with mental health is that I'm the only one dealing with it, right? It's just me. Or mental health can isolate you. It can make you feel like it's just you on an island and everyone else is fine. When in reality, you look at the numbers, majority of individuals, especially during this pandemic, right? The numbers of depression and isolation and agoraphobia. Agoraphobia is a fear of leaving your home. So now
that's called agoraphobia.
Yes, agoraphobia.
I thought that was pandemicitis.
It could be that too.
Quarantinisha. Okay.
It could be that too.
Say that again.
Agoraphobia.
Agoraphobia.
Yeah.
That's the fear of leaving your home.
Yes, the fear of leaving your home. And there's several movies on it, like Better Call Saul. You know, I'm not sure if anyone has that. Like the attorney.
His brother.
Yeah, his brother. He didn't want to leave the house. But that was also something else. I think he was a paranoid schizophrenic.
Yeah.
But he didn't want to leave his house. So to be clinical, he would be a dual diagnosis. He'll be a clinical paranoid schizophrenic and also diagnosed as agoraphobia. So the fear of leaving the home.
And he didn't like technology either.
He didn't like technology, which is where the paranoia comes in. And he heard voices and he had hallucinations. So that falls into the schizophrenia category, right? So that's another example. And there's a lot of other movies and things like that talk about agoraphobia. But now you have individuals wanting to leave the home, not want to leave the home. So that's the first thing, is that really seeing that you're not the only one. You're not by yourself. The second thing I like individuals to take from this is you can be in the driver's seat with your mental health provider. You can be the person, because usually when you go to a doctor's office, right, it's a top-down approach, right? The doctor's asking you questions, you're responding, right? The doctor tells you what to do, you do it, right? He gives you a diagnosis or a prognosis.
Right. He tell you, take your clothes off. You say, no, doc, you take your clothes off.
You could, exactly.
Yeah.
We want to turn it around a little bit. We want to turn the tables in terms of where the power dynamic is, right? Kind of like, no, how about you can interview your provider. What is your experience working with culturally competent individuals? What's your training and what's your background working with people of color? What is your understanding of working in terms of cultural competency and things like that? Do you specialize in this area? These are the questions that we can ask. So that's one thing I like individuals to take from this, is that you can interview and your provider. You can ask them questions. You can ask them for a provider directory, which should have that information on their provider directory on what their specialty is. Do they specialize in eating disorders? Do they specialize in trauma and TFCBT, which is trauma-focused cognitive behavioral therapy, which is one of the treatment modalities that you use for individuals who've experienced trauma, who've been secondary trauma, have experienced violence, things of that sort. So that's one thing that I want individuals to know. You can empower yourself to ask these questions to your provider. And lastly, something else I'd like for individuals to take out of this, is really, dive into, looking for the signs of mental health in terms of, you don't have to be a clinician, or you don't have to be, have this extensive amount of training to see some of the basic signs within your family, especially during this pandemic with your children. So if you notice that your child is, isolating themselves a lot in their room, if you notice that, they have disengaged, within the family, if you notice that they're pouring more of their time into their devices, the social media, and you notice a significant change in their behavior, there's some questions you can ask. And brotherbewell.com also has resources on their website to kind of help you guide that through in terms of mentorship and also mentoring. Also work as a mentor, helping young professionals who would like to get into the mental health field to guide them through this field, because it can be challenging to get through your clinical hours and your master's degree and your bachelor's degree and where to go, things of that sort. So mentorship, I encourage everyone to get involved with some type of mentorship, mental health program. And again, brotherbewell.com has a lot of information on that site.
You heard that, brotherbewell.com. Right?
Yes, sir.
Go get the information on brotherbewell.com. Take care of your mental health, people. Christian, appreciate you, brother.
I appreciate it. Thanks for having me.
Anything else you want to say to the people?
That's about it. Again, I really think that, really understanding some of these symptoms in the home setting is really key. And that, again, in terms of overall development, and I talked about youth, but also for adults, when you talk about adults, sometimes the symptoms could be more, they're homeostasis, which is it's stable, right? So with youth, some of the symptoms are kind of up and down, and you're dealing with youth development too. So you're dealing with a teenager, right? So when you look at a teenager, you think, they have every diagnosis in the book, but it's really, child development. They're going through a developmental stage, but an adult, usually their developmental stage has baselined. It's a homeostasis. So for adults, you want to also pay attention to your habits in terms of your daily functioning. So daily functioning is now I go to work on a day-to-day basis. How is it changing my work schedule, and how are things affecting my day-to-day schedule? So these are some of the symptoms and the signs to look for.
You heard it. BrotherBeWell.com. Christian Jacobs. Appreciate you.
Thank you.
Mic check, 1 2 1 2. Good. Good to go? What's up, man? I'm here with Doctor.
Yes, sir.
Doctor.
Yes, sir.
Tyree Davey.
Yes, sir.
I say it right, Tyree Davey?
Yeah, that's it, baby. You
Okay.
can't mess up Tyree. You said it.
I'm from Sacramento.
Born and raised.
Born and raised from Del Paso.
From a small neighborhood in Del Paso Heights called Strawberry Manors, but it's the whole 95838.
Oh, you from the? Oh,
I'll take it all. I'll take it all. Yes, sir.
If I knew that, I wouldn't even agree to do this. If I knew that, I didn't know. I didn't know they had.
That's not what we're doing here. We're not.
They ain't tell me they had me in the middle of a. You know what I mean? They ain't tell me what I was getting myself into.
Sure it was properly represented. You know.
You be doing doctor stuff and throwing up signs at the same time. Say this your problem right here, homie. I got a diagnosis. Tell us about your journey. Being a doctor, not just a doctor, but a black doctor. Not just a black doctor, but a black doctor from Del Paso Heights. Not just a black doctor from Del Paso Heights, but a black doctor from the Manors. Tell us about the journey.
So, graduated from Grant High School in 2008. I was blessed after that to go to Morehouse College in Atlanta, Georgia. When I left, I told everybody that I probably wasn't coming back after that, but there was a deep pull for me to come back. My grandmother was a great educator and administrator for UC Davis, and her spirit, because she passed in 2004, her spirit was able to pull me back to UC Davis and do a post-baccalaureate program. And took the MCAT a few times, which is a test to get into medical school. Had to take it 3 times, persevered through that. Then got into UC Davis Medical School. Now I'm at Dignity Health in South Sacramento Methodist Hospital. I'm a family medicine resident in my first year. It's almost over. Got 2 more to go.
That's what's up.
Yes, sir.
I took the MCAT too.
Oh, you did?
I did.
How'd it go?
I'm a comedian now. That's how it went.
Hey, man, I took it once. And I could have been a comedian, took it twice, and I was almost a teacher and took it a 3rd time. Now I'm a doctor. So
I was trying to be the first doctor in history with a GED.
You would have had to be a grandfather then, brother.
That's what I was trying to pull off. I was like, yo, I got the GED.
Okay.
I went to take the MCAT, then I took the bar. I said, if I can't be a doctor, let me be a lawyer.
Okay.
And then comedy.
It's really all about perseverance, brother. You know, you got to continue to grow. Look where you at now. You didn't give up, though. You persevered, and that's the same thing I did. I had to take the test multiple times, and everybody who's on this listening, you could take that test multiple times and still be a doctor. If I would have met you when you took the MCAT, I would have said, take it again, brother. I got some study tips for you.
I like to cheat on tests. That's my thing. So if you would have just gave me the answers, give me the answers. Give me the cheat sheet. But enough about me. This is about the health of the people.
Okay.
What does it mean to you? Because you spoke on a little bit about coming back home. Because you went to Atlanta you know what I mean? And Atlanta is popping.
Yeah, I loved it.
Atlanta popping.
I'll be back in October.
And you left Atlanta and said, you know, I got to come back home where I'm from.
Absolutely.
And help the people here. Now, besides you mentioned your grandmother, was there any other motivating factors that led you back to Sacramento?
I think my family was a big pull, and also just the health of my community. In 95838, there's not too many people that have access to good health care. I want to be one of those providers that provide good health care for my patients, you know. And also, I was a little homesick. I will not lie. I did want to come back and help my community specifically, because I know that there are a lot of people that don't see doctors often, and I feel like if they seen me when they walked into the office, they would want to come to the doctors more often, which means we have a healthier community overall. Because I'm going to be the primary care doctor. I'm going to be the first doctor you see. I'm literally the gateway to everything that you need in regards to your health. And I feel like I could do that here better than I could do that anywhere else.
That's dope. That was a really, really slick, humble way of saying, I look so good that when you come in and see me, you're going to want to keep coming back.
Absolutely.
That was gangster.
Absolutely.
That what y'all.
They might not have caught that, but I appreciate you for sharing. I appreciate you for giving that other.
Now, what do you think? How important is it that people like us come to a doctor and see people who look like us?
Oh man, they have so much data on that information right now. Like, if you walk into an office and see somebody that looks like you are so much more inclined to be compliant with whatever they say. whether it's medications, whether it's you should lose weight, whether it's you need to go see this doctor, whether no matter what it is, if you're African American, if you're Asian American, if you're Latinx, no matter what, if you see that doctor on the other end, you will be more appreciative, more compliant with all their information that they're providing. And that's what I want to do. I mean, Sacramento is a place where it's very diverse. 95838 has people of every color. And I feel like I can provide that to everybody because we have a common ground. We're from the underserved neighborhood, and that's kind of where I build with a lot of patients.
Yeah. Now, outside of child support, what are the top diseases that Black men should be looking out for?
How is child support number one? Child support does not cause death, but I appreciate it. It causes stress. Stress
leads to death.
That's fair, but that's not on the top of the list. Top of the list is cancer. Top of the list is high blood pressure, stroke, diabetes. But these are things that could be prevented. We're talking about preventative things. Preventable diseases are the main reason why we're dying. And for me, that's very impactful because you need to come see me so we can start preventing these things, whether it's at 2 months, years of age, because I'm a family medicine doctor, so I can see kids, or it's at 65 years of age. We can still do preventative stuff. How old are you?
30.
I'm 30.
Yeah.
Okay. You 30, you can still, we still got some screening that we could do for you too.
So like setting screens like basketball, like give me open.
Not basketball. No, more like, have you ever been screened for hepatitis C? Even if you're low risk.
Hepatitis.
At the age of 18 and up, you should be screened for hepatitis C. I know you probably got a Hep B vaccination when you were a child and you got that series. Yeah, that's good. But hepatitis C is a thing that we're testing for as well. Have you had your blood pressure checked?
Yep. I had some bloods pressure me. And
No,
I had on the wrong color.
That's not it.
Oh.
That's not it. No. We need to put the cuff on your arm. We need to assess your blood pressure.
Oh no, I got that. I was in the grocery store waiting and I put my arm in the thing.
Oh, you did
and
that?
It squeezed me real tight.
Was it a good number or a bad number? Do you remember the number?
I didn't understand the number. Whatever the number was, they said I was all right.
I'm gonna pray that it was low for you. But little things like that, and then as you get older, 45, we're starting to screen for colon cancer a little earlier. You know, the Black Panther, Chadwick, passed early.
Mm-hmm. Yeah.
We could do screening early on, 45, prostate cancer, and other things that happen higher in African Americans. We need to start coming to the doctor so we can make sure we don't have these things. The issues with African Americans is we wait till the end. It's stage 4. It's end-stage liver, end-stage kidney disease. You already have heart failure. We could have been doing something with your high blood pressure, your chronic kidney disease early on. We could do things earlier, but sometimes we have fear, distrust, lack of access, and those things shy us away from going to the doctor.
What are some of the preventative things that people can be doing on their own?
Right now?
Yes.
1, you could go to your doctor. 2, we could 150 minutes of exercise every day. I mean, not every day, sorry. In a week. 150 minutes divided by 5, that's 30 minutes of exercise a day. That could be a walk. It could be a CrossFit. It could be whatever you would like it to be.
Sex.
Your heart rate goes up in that. I want you to get some different type of physical activity. That is, your heart rate goes up, and it's most likely aerobic exercise. But I want you to get some walking, jogging. You could also
said 30 minutes a day.
30 minutes a day.
So then after that 2 minutes, you've got 28 minutes left of exercise.
There we go. Yeah, so you can't rely on what you said, the intercourse, to give you all the physical activity that you're going to need in the whole week, okay? We can also talk about salt. Man, how much salt you use. When's the last time you had some top ramen?
I'm not.
You're not doing no top ramen?
No.
Okay, well, that's fair. I appreciate you got Jordans on. You probably might not have the top ramen. But what I'm saying is...
They fake.
Dang, the Jordan man. I remember him. But...
He got a tennis racket in his hand. If you look at my jump man.
The salt in everybody's diet is really high, especially in packaged foods. We do a lot of things like buy canned goods, eat top ramen. And then also add salt. Everybody loves Lowry's. We add some Lowry's on the top. We got to start decreasing the amount of salt in our foods because salt increases our blood pressure.
Mm-hmm. So you're saying decrease in salt and increase in what?
Increase. Well, you actually asked the wrong guy because I'm a vegetarian, almost a vegan. So I want you to increase your fruits, your vegetables, and I want you to get some tofu. I want you to get some beans. I want you to get some seitan. I want you to get these natural proteins in your body, not meat.
Yeah, I like it. I don't eat meat either.
Oh yeah, I didn't know that.
Yeah.
Okay, I want to see a vegetarian dish from you on your gram soon because I know you do that.
Yeah, if you notice, I don't never post no food on my Instagram.
I know. I want to see some vegetables.
Yeah, I eat a lot of quinoa.
There we go.
And mushrooms.
There we go.
Green beans
there
and okra.
Get some kale, some spinach.
Kale, spinach.
Chard.
Yeah.
There we go.
That's how I eat.
Okay, I didn't know that.
Mm-hmm.
That's good stuff.
Yeah.
That's good stuff.
How can black men get connected to the resources in their community?
Right
in
here.
The health field.
Not necessarily me. Any primary care. Firstly, if you have insurance, you need to reach out to your primary care doctor. Your primary care doctor is literally the gateway to everything that you need. Whether it be, I need help with taking care of my grandmother, and I already take care of her, and I need you to fill out this form for me so I can get paid to take care of my grandmother. Who's filling that out? Your doctor. If you have high blood pressure, diabetes, who's going to help you with that? Your primary care doctor. If you don't have insurance, Cover California, you are blessed to be right now in the capital of Sacramento, in the capital of California, and Cover California is here. They can get you signed up with Medi-Cal if you make $0, free service. Cover California or go to your primary care doctor. I think that's the best way to get to the resources.
Okay, and what's the best way for people to reach out to you?
Man, I'm from Sacramento. If you know Sacramento, you know it's a small network of people. You could get a hold of me any way.
Okay.
Any way possible.
Anyway.
Reach out to him. Reach out to any of the capital cities.
Go to the Strawberry Manors and ask for Dr. Tyree.
Now, but you can ask for me, and I guarantee you somebody will find me. I did want to say something about at least just advanced care directives. Working in the ICU during COVID times, I've seen a lot of people that didn't have their goals, their wishes written down on paper. And I would like you guys to think about writing that down on paper. I know it scares you to think about death, but it would be much better to have your own wishes written down on paper rather than one of your family members saying what you would like when you may be too sick to speak for yourself. Advanced Care Directive, remember that.
There it is. Dr. Tyree Davey, appreciate you, brother.
No problem. Nice to meet you, brother.
Pleasure.
Hello. Welcome back. I hope everyone has joined themselves. My name is Aaron King. I'm Secretary for Capital City Black Nurses Association, and I want to introduce two gentlemen here. We got Mr. Ray Green and Nathan Houston. They are representing My Brother's Keeper, Sacramento, MBK, and the Center for Fathers and Families. So I'll go ahead and start. Can you tell me what's unique about the Center for Fathers and Families and My Brother's Keeper, Sacramento?
Yeah, definitely. So I'll start off with My Brother's Keeper. So My Brother's Keeper got started when Trayvon Martin was murdered in 2014. President Barack Obama decided to say, you know, that could have been my son. We got to look at our policies, procedures, and practices, the environments that create the conditions for young men of color to fail. And we want to make them thrive. We know that they have many dreams, ambitions, and goals. So what makes us unique, honestly, here in Sacramento is that we really center on the youth voices. The youth voices lead the change that we want to be able to visualize here in the vision. We want to be able to do this work. It's a collective impact really to improve life outcomes for boys and men of color. And then we want to be able to do this without all of the phenomenal community partners. We have over 230 network members who are on the ground doing health, education, workforce, and even public safety and juvenile justice. So without all of that, we wouldn't be able to keep lives and move forward for their vision.
Yeah, that's a great network. We actually connected in one of the Zoom calls. I think that's how a lot of people are starting to meet these days. It was just amazing that we had the luck to connect that way. So go ahead, tell us a little bit about Center for Fathers and Families.
Yeah, thank you. Nathan Houston, Center for Fathers and Families. It's an organization, nonprofit organization that was founded in 1994, and then by Matthew Crane. In 1997, Rick Jennings is the current CEO, took over in 97. And so the organization was formed because there weren't a lot of programs for fathers. As you look out into the world, there's a lot of support for mothers, but not a lot of support for fathers. And so we're an agency that focuses on strengthening fathers and the family. So we don't neglect the family aspect. We do focus on the family as well, but a lot of our work is to focus on the father. We believe that if we focus on the father, the family will be stronger. If the family gets stronger, the community gets stronger.
Definitely, and I think that's kind of be looked at as equity, right? So since there's so much resources for mothers and for children, it's very great to have a group that works strictly with fathers, because we don't want to leave them behind, right? So what are some of the skills that young fathers can learn to set their families up for success?
That's a good question. I think for me, as a young father, have two. Shout out to my babies, Natalie and Nala. And I think for one, I'm going to say is communication. Growing up in a black household, there wasn't a lot of communication, intentional communication. There was some communication as far as, better get up out that bed, do what I say, things like that. But as far as being able to have conversation and dialogue that went both ways, there wasn't a lot of that. So for young fathers who are out there having intentional dialogue, and then I would say the second thing is increasing your social and emotional learning capacity, because again, within some of our households, we don't have the opportunity to grow emotionally and mentally in that aspect when it comes to assessing how you feel. So when I'm talking about SEL, social emotional learning, I'm talking about, the self-awareness, self-management, right, responsible decision-making, things like that.
Yeah, all right. And Ray,
can I add to that, actually?
Yeah, go for it, brother.
Yeah, so being a young father myself as well, we got one on the way. Because you gave a shout out, I got to give a shout out to my daughter Destiny, my wife Demetria.
Yes, just had a birthday, right?
Just had a birthday. Yeah. One of the things that I really feel when we work with our youth who didn't have fathers, that they are soon to be fathers, is the power of vulnerability. It's a skill set, because a lot of times in our communities we don't trust, right? We miss out on trust. And part of the way that we do that at the Center at Sierra Health Foundation, talking about equity, and what we've done with the Obama Foundation that we've received nationally, is to expand mentoring. There's power in mentoring.
Yes.
And I would say the reason why there's power in mentoring is because these are people with lived experiences, giving and sharing their stories, their victories, their wins, their failures, so that young men can have proximity to somebody to say that I see somebody who's been vulnerable, so now I can implement vulnerability with the next one. So just being in proximity. I would also say reaching out for help. I think it's a skill set to say, I need help. It's not a bad thing. We all want to grow. We all want to learn. And part of that is being open to say, I need help. And I think for Sacramento, and in partnership with MBK Sacramento and Center for Fathers and Families, there is help. Men who understand, men who have lived experiences, men who want to give back and also be able to receive as well. So those are all skill sets that I would lean to any father.
Yeah, we talk about mentorship, and I think it's exactly like focusing on the youth, the young males being able to get mentorship and carrying that on professionally. Because we talk a lot about professional mentorship. I know it comes up in healthcare, whether you're a physician or you're a nurse. And so being able to rely on mentorship to kind of guide your way. And so what are some of I know there's a lot of different mentors that you can have in your life, whether it be professional, whether it be personal. It seems like a lot of the mentors that you're talking about, it seems like it's more of like a personal, like how to move, how to react in the classroom, things like that. Is that right?
Yeah, I think that's a part of it. But even we know that research shows that when you have a positive adult relationship with a male or anybody, there's significant academic goals that have been met. There's significant social networks. Social networks lead to workforce opportunities, and relationships is like the biggest key. Some of the other mentorships that we've done in partnership with the city and the county of Office of Education here in Sacramento is providing positive male role models to be interventionists for mental health, especially during this pandemic, right? To have somebody you can vent to have somebody that can teach you some game, to have somebody that can show you or even hear and help you get to where you want to go. All of that is prevalent in mentoring. And it just takes a caring, a loving adult to be able to step in somebody's lives. Because we got to keep in mind, if we're talking about fatherhoods, the truth of reality is that before I was a father, I was once a boy. So that trajectory going from a boy to adolescence to being a young man, I needed mentors in my life throughout that whole duration of that, right? So part of our role at MBK is really making sure that we provide that in the lives of our young men who are going to be fathers as well.
That's great. And I know we talked about, we talk about now how we operate in the pandemic, right? And you talk about mentorship. So how is it that, and I know you could touch on this too, Nathan, how is it that we navigated that with this in this life of social distancing? I know this is our first time meeting in person. We've had lots of meetings over the phone, Zoom, right? People's hair looks good, your braids are tight. I mean, it was an old photo. So you're like, there's a lot of hair now. So definitely, how have you guys navigated that? How's your Center for Fathers and Families and MBK Sacramento, how have you navigated that, being able to have mentors available for these children?
Definitely, I appreciate that. I think, well, as Ray was talking about it, right, a lot of times looking at Zoom, right, we know that Zoom has been a key factor in making sure that we stay connected. But going back, I want to kind of focus on the fatherhood aspect for a moment and looking at and talking about mentoring and thinking about our agency, right? So I've been with Center for Fathers and Families for the last 23 years, right, in some capacity. Start off as a participant, then a volunteer, then frontline staff, then a site coordinator, and now director. And so looking at, it was the agency, right, having this program that was available for me as a young person who lost their father, right, at 15 years old, now trying to figure out how do I become a man, right? These are pivotal years. So for me, looking at having an agency like that provides programs. And so that's how we do that, right? Center for Fathers and Families provides programs to give access to young people. And then what's also unique about that is that we provide a space that is, we try to hire folks that look like the young people that we serve. So that they actually they can connect, right? They have relevant information that pertains to them. And that's what drew me to Center for Fathers and Families. And that has kept me there for so long is because I know that without this program, my life, I wouldn't be here on this stage. I know that for a fact. So that's one of the ways that we do that, by providing programming, but also, making sure that we have funding to provide those programs.
All right. Yeah, that is very important. Having people that look like you, being able to reach out to you, that is very important. And then also just the coworkers, working in a space where you're comfortable, right? You could be yourself and you could really touch this group. That's why representation is so important. We talk about that a lot in healthcare. That's starting to come back around when building trust with the community that we serve. So what are some of the projects that you're working on? What are you excited about?
So honestly, this year I'm excited because understand we serve 4 different focus areas: education, health, workforce development, and then public safety and juvenile justice work. So we have partners who's busy in every single lane, right? And that's a word for somebody is just understanding your lane. There's many lanes, many hats to be filled when you're talking about change work, especially for fatherhoods and future fatherhoods. So some of the projects I'm really, really excited about is not just the program aspect of it, there's a policy aspect of it, changing the rules of the game at the state level, at the local level. Here in Sacramento, we just unanimously passed last year, due to all the turmoil, all the uprising, all the racism, everything that we experienced, a public safety resolution here at the city, which redefines public safety. Now what that does is redistribute dollars, right, to programs, to keep the future fund and sustainability. All of that's a part of this work, and it's so important in reaching the youth. So in education, we're excited to have the 1300 campaign. If any of you look up the 13th Amendment, you cannot be a slave technically unless you're in the school to prison pipeline or in jail, right? So we know that the school to prison pipeline is real. We can talk about it. We see data. We see all of that. But keeping in mind that these young men have visions, they have ambitions, and because we value them, we want to put them in the right position. So every single young man Black and brown, who applied to UC Davis this year. It's a local university. Sac State, a local university, who applied. They didn't get denied this year. We changed the policies. We said, listen, your institutions should give them a provisional or a conditional acceptance. Don't just throw them and tell them, no, you're denied. That's just another no that they've already heard multiple times. We want to change the pipeline for that. So I'm excited because we've already accepted 100 adult young men, over 100 adult young men who were once denied, now in a program getting mentorship, wraparound support at a community college level, who will then, once they meet the credits, they will then be able to have access into that university that they once were denied in. The other, in health, we have trauma and healing learning series. It's important, men, to make sure that we address our trauma. We have phenomenal partners here in Sacramento who are really leading that way. What is institutionalized racism? What is structural racism? And how do we navigate that as a healthcare practitioner when I'm engaging with young men? But not just from the perspective of physician, student or physician and young man. The young men are getting to inform you all as well who are practicing health, right? To be able to engage on a better level so that they can feel comfortable to seek mental health. They can feel comfortable showing up at a shop, making sure that they get that other piece. The other lanes, I'm going to quickly touch on that, is diversion. We know the arrest rates in Sacramento, probably in your neighborhood, probably in your state, are really, really high, right? We're always at the top of the totem pole for bad reasons, but we have a diversion program getting ready to start here from funding that we receive from the state to say, how do we divert? How do we take away and change the course for young men and young women, kings and queens, who may have gotten a low-level citation, drug, whatever it may be, right, to get placed at a community center so they get culturally relevant teaching, culturally healing, and then placed with necessary resources as well. And then the last one, before I forget, is making sure that we also expand workforce opportunities so that they don't have to sit on the block. Their dreams can be met with reality. No dreams should be deferred. So working with city, working with organizations who train you, who coach you, who give you clothes to show up to an interview and get you hired to build that social network so that you know somebody at that job. So we're really challenging, we're really pushing, and I'm so excited for all of the work that we have laying ahead.
Yeah, that is exciting. You got something to add?
Yeah, definitely. So for me, one of the things that's surfacing for next week, I do want to shout out Juneteenth, right? And we have a special event called the Music, Men, and Medicine, right? So we're talking about health today, fatherhood, but also the focus is on prostate cancer, right? Prostate cancer awareness. And so we'll have saxophonist Eric Darius coming out, Rick Braun, and the goal is to have the conversation again about health. And so that's one of the things that's going to be happening this coming week. We also are kicking off our summer program. So our agency focuses on adult services, but we also have youth programs. So we have our summer programs. We know that there's been a lot of learning loss because of COVID. So we're excited about being able to provide safe spaces for our young people to engage with them academically, and socially to help them continue to, retain information. But then again, just getting back into interaction, right? Having conversation with people in a safe space, because we know that during COVID-19, a lot of our young people were isolated and weren't able to have conversations or talk to anyone. So I'm looking forward to us being able to kick that out. It'll be a 6-week program that we'll be working in multiple districts. And we're looking forward again and then we're also just excited about the upcoming school year, just because, again, schools have been shut down in a sense, right? And so for us being able to, again, focus on social and emotional learning, that's one of our key things, right, is that character development, because we know that that's how we have, positive contributors to society. Right, you got to focus on that SEL, get them ready to be able to engage with one another and with society. So we're excited about that. And then our fathers here, we have a program called Daddy's Here. We want to invite all men, right, who are here in Sacramento, if you're here within the region, our Daddy's Here program every Thursday, whether we have it in person or in Zoom, and we're excited about that. It's just a space for fathers to be able to come, it's a support group, and then we have multiple other classes as well, parenting classes, anger management that we have throughout the summer. So a lot of things that are coming on. Go to cffsacramento.org and get involved, because we here.
So Daddy's Here. Everybody should be reaching out to that, because, these are resources that are available nationally, right? We're talking about online platforms. It's not always going to be online, but definitely right now, take advantage of these resources. So where could, our men that are watching, our viewers, where can they go to get these resources, and how can they find your organization? And we'll stay with Nathan because you've been talking a lot. You said you were going to share it.
It's all good. It's all good. So, yeah, if you want more information on Center for Fathers and Families, please go to cffsacramento.org. cffsacramento.org, or you can follow us at CFF Sacramento on Instagram and Facebook, and you get access to all of learn more about our classes, the resources that are available, and then our after-school program. Shout out to our Master's After-School program. I definitely got to highlight this, right, because I had the privilege and honor to launch our first after-school site. Wow. Back in 2007, and so now we're at 10 different school sites in 3 different school districts here, and so that program means a lot to me, and again, I started when I was 19 years old, so that though you have to do the math to see how long I've been around. But then also to see the young people, right? I'm at this age now where young people are coming to me. They're graduating from college, graduating from high school, and like, Mr. Nate, I remember when you were telling me to get to class and to stay focused, and so I'm excited about that. And so if you want to get involved, we need volunteers. You talk about mentoring. We need mentors, and we're looking forward to just continue to collaborate with MBK Sacramento. So follow us at cffsacramento.org.
All right, Ray, you can have it back now.
All right, so with 30 seconds, right, I would say Google My Brother's Keeper Sacramento. Google My Brother's Keeper Sacramento, and you can also follow us on Instagram at MBK_Sacramento. The other beyond just MBK Sacramento is the Center at Sierra Health Foundation, because our foundation, which organizes in the center, it fights for health and racial equities. There's many programs, there's many funding opportunities for all of you who have wonderful ideas, and also capacity building that people can tap into. I would also end with this: vote, find a neighborhood near you to get connected to, become a mentor, advocate for fathers all over, and continue the great work.
Last thing.
All right, Nathan. Go ahead, bro.
Shout out to my wife, because Ray he's gonna get me in trouble. I heard him shout out his wife earlier, so I've been holding that. Shout out to my wife, Erica. I love you.
So before we wrap out, I better shout out to my wife, because she's watching me with darting eyes. I'm not looking, but I can feel it. So shout out to my wonderful wife, Joy, for supporting all of this running around. But I just wanted to say thank you again for coming. Ray Green, Nathan Houston, thank you. Centers of Fathers and Families, My Brother's Keeper Sacramento. It's amazing, and it's just been an honor to have you here. Thank you so much. We're going to go ahead and cut over to DJ Soup before we transition over to New York.
Five, 4.
And we're back in New York City. Welcome back. All right, fellas, how y'all feeling?
Great, great conversation.
Yes. So we had some interesting conversations behind screen that I want us to bring back right now. Let's start talking about some interesting conversations about Black men not having health insurance and why we should have it, advanced directives, life insurance, those kind of things. So let's just start about that. And let's start with Black men not having health insurance and why we feel we don't have it and what we should do about it.
Well, not having health insurance puts you at a disadvantage of when you do enter the medical system for an issue, you're entering at an inefficient step, meaning, the most appropriate way to get to see the orthopedic doctor is you have to have a primary care doctor, and then that person will direct you to the orthopedic doctor if you have like a bone issue. If you just go to the orthopedic doctor, depending on the practice you go to, they may not see you without a referral. So having a primary care doctor allows you to have an entry point so that you can get some knowledge on how to proceed to address whatever problem you may have. But also it gives you a space where, because some of these problems, like blood pressure, for example. You don't always feel symptoms if your blood pressure is elevated. So you need to have a mechanism in place that allows you to check your blood pressure regularly so that if it is elevated, you can begin the process of addressing it. And again, a lot of times that comes in the form of a visit with your doctor. So, I think that, again, that's the purpose I see with having a primary care doctor. But unfortunately, a lot of us don't. And we have to use other mechanisms that are in place. There are a lot of free clinics. I work with a free clinic in Long Island that takes care of individuals with no health care. But you've got to sort of do your research. Luckily we have Google now, or search engines on the internet. You can put in free clinics near whatever vicinity or neighborhood you live in, and that could be a starting point for you. But again, when you out here and you don't have nothing, you get sick, it can go from something very simple that can be easily addressed to something that impairs your whole function. So I do think that we're at a major disadvantage, anybody, Black, African American, anybody, if they don't have health insurance. Because again, your whole initial first step is an inefficient one. It's one that's may not necessarily get you to where you want to be. So that can be kind of frustrating. And as we said earlier, we are quick to cut our nose off to spite our face. So I go to you and say, hey, I need, to see this doctor. I got this problem. You're like, well, you need insurance. And that whole little unreadiness makes you say, you know what? F this, man. I'm not messing with them. And then that problem is not going anywhere. It's still going to need to be addressed. And unfortunately, what happens? You got the day when it's your family member's funeral, or you got to do all of these things on that day. And now that blood pressure that somebody told you about, now you having a heart attack. I had a patient once who had high blood pressure, and he never took advantage or took care of it. And he had a stroke, and the stroke paralyzed him on one side, and he can only say the word yes, yes, yes. And he had a wife and kids, and she left him after about a year. And I remember when he came to see me, he was in a homeless shelter. And, he was being real with it. He was like, you know what? I know why she left me, because I had an opportunity to address this, and I didn't do anything about it. But, again, nobody wants that type of horrible scenario to happen to them. But if you react instead of prevent, reaction costs more than prevention does.
I think it's based off of two primary things why a lot of brothers don't have health insurance. I think one is people are neglectful because they're used to being healthy, right? If you're that dude that only gets sick once a year, you just, you barely take medicine, or you sleep it off or something like that, take some over-the-counter medicine. Most of the time, you're not going to be like, all right, I need health insurance. Hey, I saved all this money. I don't need to spend money on it, right? But then two, it's also the disciplines that Black men work, right? So I'll use, for example, the barber shop, right? Most people are 1099 employees, right? Or, I shouldn't say 1099 employees, they're independent contractors. So when you rent the booth or you on commission, you don't get health insurance, right? It's up to you. It's up to you, one, to report your own taxes, and then two, it's up to you to find health insurance. And if you have to find life insurance, that's all on you. It puts the focus on you. And I think a lot of times we used to making money hand over fist and not necessarily thinking about those particular aspects of our lives that's going to require a lot of attention. So people put their money in different places, not in the places where it counts.
So let me ask this, especially how many people here, how many men here on the panel, and even men that's listening right now, how many men here have a primary care provider in some form or another? Cool. That's like half the people, half the Black men that answer that question. Then the other question is, how many people have seen their primary care provider in the last, let's call it, year and a half? Right? But those are important aspects of it. And I also get that sometimes, like I think about my mom growing up. Anytime as a kid I needed to go to the doctor, mom had to take the day off, which meant using vacation time, using sick time, or not being paid, right? And when you think about the position that we are in economically as a people, if I gotta lose money to go to the doctor, but I still have to pay rent, I gotta pay utilities, a lot of times we're not gonna go. Yeah. And it's on us as healthcare providers to find creative ways to do that, right? Like I always say, people will tell you take your child to go see a doctor when they're sick, but all the pediatricians and all the pediatric nurse practitioners, day hours are doing work hours, 9 to 5. So if my child is sick, I can't necessarily bring them to them afterwards, or if I want to prevent a problem, right? And I just want them to be seen for a regular checkup. I have to take the day off just for a checkup of my child. That can be cost, like that can be cost heavy.
Well, one of the things that I do is we have evening hours. You know, we also see patients. I work on Saturdays and Sundays at times because, again, the working man and woman don't have the abilities to say, oh, I have X amount of sick days or I get these days to go handle business that are given to me by work. So you've got, again, like I said in the previous segment, we got to bring it to the people. And part of bringing it to the people is if you want to be a healthcare provider in that type of community or this community, you've got to make sure that you're available at times that are convenient to the people that you would be serving.
And we got to also think about the communities that we're serving. A lot of the communities in New York City are heavily populated in regards to Spanish speaking. So think of language barriers, think of like culturally, how you were raised, a little cold, you have remedies to do these things. So it was never an emphasis to go to the hospital or go to the doctor for a checkup. Like even now, taking care of a 30-year-old female in the ICU whose blood pressure is through the roof, whose blood sugar is through the roof. And she's just like, I just want to be alive for my kids. But I'm like, you want to have a conversation with me? So also utilizing like the barbershop, utilizing any opportunity to interact with someone, to educate them and you know, provide them with resources is something that we have to do. It's our duty, you know, being able to have those tough conversations and say, look, I'm gonna be honest with you. We could close this curtain, we could close this door. I'm not your doctor, but this is what I know. And this is what the end goal is gonna be if you keep going down this path. And typically sometimes, because if I'm talking a certain way and I look a certain way, I carry myself a certain way, they seem to be more receptive to it. You know what I'm saying? So we need to do more of a job at those that are in the fields and have the knowledge and the resources to when we have those opportunities. You could be in a supermarket on the line. I was in St. Martin with the family, and the cashier, she's talking about her A1C was 12, talking to her friend. I was like, you diabetic? That's diabetic. You know what I'm saying? She's like, I don't know what that means. I said, your A1C is supposed to be less than 5.7. You know what I'm saying? She's like, they're trying to put me on this medicine. I can't afford this. And then I started talking to her about lifestyle, diet, you know, regular checkups, things like that. And she didn't want to let me leave the store. I was like, Mom, I got to go catch a flight. But just those little interactions with me just being a little nosy could change somebody's perspective.
Because you know what people will do? You know, they will not. I've had patients who are uninsured that said, you know what? I got to pay my mortgage this month. It's either mortgage or insulin. I'm not going to get my insulin. So they walking around the whole month with a sugar between 200 and 300. And that's like standing on the edge of a cliff. And all you need is a cold or any type of infection and you're getting pushed off. And now you're in the hospital and shoot, a day at Hotel Stony Brook Hospital could be 1 stack, 2 stacks, and you got to pay all of that out of pocket. And I know their collection services are no joke. You know, so again, I try in my practice to connect the dots. You know, like an interesting situation that just came up was it was a gentleman who was leading the Memorial Golf Tournament. He was the leader after second round. He chose, for his personal reasons, not to get vaccinated. They had to do routine tests during that week for people that weren't vaccinated. He got tested positive. If he would have won the Memorial, he would have made $2 million. And because he wasn't vaccinated, he had to be tested. The test came back positive. Because he was positive, he was put out of the tournament. You know, again, an example of how prevention or lack of prevention can cost you money. Because sometimes, people don't feel a heart attack or a stroke. They don't feel it, but they'll feel money when money's getting taken out their pocket. And, as we go back to school, and there's this whole message of, want to get vaccinated or not, even with businesses. I see there's a hospital in Texas. They've got about 200 people that are protesting having to be in the hospital, work in the hospital, and be vaccinated. Do you really need your job? So I think sometimes you've got to put it in a space that people feel. And a lot of times people feel when you're messing with their money, their livelihood, but actually in all actuality, they're messing with their own money and their own livelihood.
So interesting enough, when I teach diabetes, one of the things we tell my nurse practitioner students to focus on when they're talking to patients is, listen, you tell them diabetes is one of the leading causes for you to go blind, because people fear going blind more than they fear dying, right? And I always tell the men, right? Impotent. But no, tell the men, right? You're not going to be able to have sex, right? Like your diabetes get under control enough. Men fear the inability to have sex because of how we define our manhood. More than death. Right? Like you'll have some men that say, I can't have sex no more. So you know what? Go ahead and just kill me. Right? So when you tell them, yo, look, some of your erectile dysfunction problems you having of not being able to get a full erection, that's just from your lack of control in diabetes. Right? So being able to understand those little things. Right? I remember seeing a patient for medical marijuana certification. And the patient was like, since I have you here, doc, let me run some other things by you. Now, of course, I'm like, this might be his only chance to really talk to him about it. Cool, what's going on? He tells me, look, I'm on blood pressure medication, right? And I'm on diabetes medication. Sometimes when I take it, I can't get an erection, right? So anytime my lady is coming over, I don't take my medication. I said, you had this conversation with your doctor? He said, yeah. I was like, what'd she tell you? He goes, she told me, this is not the medication. This is just you. You got to deal with it. That's not understanding your patients and not understanding what they want, right? Like she could have easily switched him to a different medication that wasn't going to have kind of side effect, and he'd have been eternally loyal to her.
Yeah. Or he could have gave him something that might have he might have needed a little nitroglycerin.
But I think everything in life is connected. It's up to you to find the correlation. And a lot of times we look at these isolated situations to be like, I need to fix that problem, when they actually it was a domino effect. So when you talk about, lack of health insurance, not going to the doctor, people complaining about their paychecks, but they're eating out breakfast, lunch, and dinner. These are symptoms of something that's bigger. So like I said, I'm of the mindset that everything in life is connected. It's up to you to find the correlation.
You know where it starts? With our youth. We shouldn't get to college to start paying attention to how we got to start taking care of ourselves. Graduating college, we should be instilling that into our kids and our community, the kids in our community from young. They shouldn't be coming to school in the morning eating candy for breakfast. You know what I'm saying? Like little things like the school in the South Bronx, that's what they eat for breakfast. They don't have no family that could provide them with breakfast. Some of them can't even make it to school in time to get breakfast. You know what I'm saying? But just imagine educating them and they're growing in like any other family culture or tradition that's repetitive. They're gonna, after a while, just gonna be a part of their life. We have to start educating our kids and really pushing them.
I'm from the South Bronx. I'm from the hood, the South Bronx, Morrow Senior area, still one of the highest crime district areas to this day. Over there, right? And a lot of times you're not taught certain things, right? Everything comes with a price. To be successful, you have to go seek knowledge, right? Otherwise, you're gonna end up doing what everybody else is doing. But this is a very complicated onion that you got to keep unraveling from, what's being portrayed on television, to our kids wanting all of a sudden what's the nutrition plan for our kids in public school? Are they being fed cow's milk? Like all of this stuff is a lot to really unravel here. So, if people don't have the knowledge, a lot of times they go with the status quo. They go with whatever people are doing around them. So we got to figure out how to get to them.
And I think we have to start being more proactive in the things that we are create that's going to shape our neighborhoods. So it starts with things like this, like, oh, let's have this collaboration with Sacramento. But then that spiral off into you saying, no, we need to do something a little more consistency for these neighborhoods, right? And now we're in talks about doing that. It starts with saying we have our children living in food deserts, right? So I grew up in Brownsville, Brooklyn. Like I think food deserts is a rural neighborhood thing. And in my projects where I grew up in, there was 2 Chinese stores, 2 liquor stores, 2 rundown grocery stores, a supermarket with probably expired stuff. And this is how we live, right? But then I also I teach at LIU Brooklyn, right? And across the street now, after gentrification, right? You got a Whole Foods, you got a Target, you have all these healthy choices, right? So one, there's that option, but then also the people that live across the street in Fort Greene projects can't afford to go to Whole Foods and pay for it, right? So we have to do things to now shape the narrative where we're going to drive funding into our neighborhoods. And I want us to use, because right now the hot thing is COVID, right? And everything that you can relate COVID-19 to, the government is trying to give you some type of funding for. And we have to jump on that to shape our neighborhoods. Because if we don't, somebody else that don't understand the neighborhood, that don't know what happens, they're going to get that same money and either pay us pennies on the dollar to do the work or make the decisions for us. Right? And I think it goes to, and I want us to touch on, because something Dr. Phillips was saying a lot was, start using funding through barbershops to talk about healthcare. Start using funding through barbershops to reach people, right? So I want you to expand on some of those ideas, and then we can get Charnay to add on to that as well.
Well, what you've seen as we've gotten through COVID is, as we've gotten to a place where there's adequate vaccination available, they've seen that there's been a reluctance of people, especially people of color, to get the vaccination. So what they were looking at was the messaging that was occurring, which was Dr. Fauci, and Dr. Fauci can't come up in here and talk and convince y'all. And no disrespect to Dr. Fauci, because I pay attention to everything he's been saying. However, one of the things that we recognized as medical professionals was we've got to bring the message to the people. And part of bringing the message to the people is engaging institutions that are within our communities that have historical legacy of being trusted. Barbershops being one of them because we're in one, but also our churches. And those are areas now that the federal government, in trying to, use this initiative and reaching these people that have not decided or are reluctant to get the vaccine, investing in activities with these institutions because they're trusted, so that they can bring the message, because they're now recognizing, and I think you said something just a few minutes ago, which is paramount, which is COVID has provided us with a backdrop to now talk about this stuff. And because of the immediate severity of COVID and how bad it's affected us, we have seen that the ways that they have engaged us with healthcare historically have never really worked for us. And that is in part one of the reasons that our numbers with all of these health metrics are so poor. However, what COVID has said is if we don't make any changes, then this thing ain't going to get no better. So change seems to be now taking an approach to reach us in a way that is more palatable or digestible by us, meaning using faces and places that are comfortable and familiar, using language that is familiar to us, presenting ourselves in a way that that young man can say, I can relate to them, as opposed to coming in here like, hey, you guys need to be about getting your cholesterol checked on an annual basis on a serum fasting test. And everybody in here will be looking at me like they're looking at me right now, and again, that has resulted in part to why we are lagging behind in so many health metrics. The most recent and most significant one, the vaccination. As I said earlier, almost 600,000 people dead from COVID. 45% of that are people of color. 11% of the general population of the United States is made up of us. So we are bearing a heavy, heavy weight. And that is the motivation, in my opinion, of us or the government having this newer initiative using places and faces that are familiar to us in getting the message out here. So,
you know, I just think about some of the things that our folks do. And, you know, when you think about supply and demand, when you think about if you give somebody something for free, they invalidate it because it's in abundance and it's free. But if you make it so high priced that people got to save up 3 and 4 paychecks to get that, all of a sudden that becomes a thing that people need. I think about all the time when you see these stores, how many people are lined up for a pair of Jordans. You know what I'm saying? A pair of Jordans. Now, I get that it's not the same arena, Jordan's vaccinations, but think about you're in line. When I got my when I got my COVID shot at my church, at a black church, I saw a lot of white folks, right, taking advantage of the fact that they could get the COVID vaccine. I didn't see a lot of people. I didn't see a lot of black folks, right? So yeah.
So I had a patient. I just say this real quick. I had a patient come from Stony Brook and went to Brownsville and got their shot.
That don't surprise me.
It was like, yo, I'm going to get my shot. You going to Brownsville? He was like, Dr. Phillips, I'm going to get my shot. I said, you ready for Brownsville? They were like, Dr. Phillips, I'm going to get my shot. But again, terminology they've used for them, they call them vaccine tourists.
Yes.
You know, and because of us doing the double dutch, you know, they're like, yo, move out of the way. I'm going to go get that.
So our chapter runs a vaccine clinic in partnership with Community Health Network, FQHC, right? Mm-hmm. So they approached us about just some of the marketing material for it. And we told them, of course it has to be in a black church, but it'll make more sense if you have black nurses giving the vaccine. Yes. Mm-hmm. And it's like, what do you mean? I said, people feel more comfortable when they, like, for whatever reason, when a patient walks into my office or I walk into a patient home, the first thing they do is take a deep breath and relax, right? Yeah. Like it's somebody that looks like them. People. When I start code switching and they can understand the things that I'm saying, it makes them. So now we're running the clinic and it's going well, right? Because at first it was in East New York, right? And they kept saying, yo, why are all the white people coming to this black neighborhood to get vaccines? And I had to explain to them, they know how to work the system. And then the second thing is our people don't trust it. So you combine those two things, this is what you're going to get. But now that people see us walking in and out, hey, yeah, I'm Dr. Johnson. How you doing? Yo, hey, this is Nurse Josie. We're running a vaccine site. Y'all, us? Yeah. I'll be here. But even more, I'm telling somebody else to come next time as well.
Right. And you know what's funny? Like I tell my students all the time, whatever you selling, before anybody buys something from you, they buy into you first. So it's really establishing credibility, because even when you show up and you're a black doctor, they want to just make sure that, you know, you have some credibility. Like, all right, this guy doesn't seem like he's going to rip me off, or he's a credible person. All right, so tell me about this vaccine. It could be selling a car, right? They're establishing credibility first. And then once they establish credibility, then it's like, all right, now what do you need to tell me?
Absolutely. I always ask the dealer that's trying to sell, you drive this brand? Yeah. Oh, no, I got to, all right, that's all I need to hear.
Right. And I also, like, I love when healthcare providers dress like this, because I do house calls dressed just like this. Right. And some patients, they're like, you sure you're a doctor? Dressed like this? I'm like, yes. Right? And I tell them, I'm like, yo, two things. One, if I walk in here with a three-piece suit, these projects, I'd have became a target. Right? Because knowing what I know I have a point now when I leave. I was like, but two, it don't matter what you think when you see me. It only matters what you think once I leave. Yeah. Right? So I think those is important. I think, you know, thinking back, and I'm sure you're familiar with the American Rescue Plan and the money that's being released they want to broaden the scope of emergency healthcare providers or healthcare workers, right? So not necessarily just nurses, doctors, but also people in the communities. And they're giving funding for that. that has to go through places like the barbershop. It has to go through places like the black churches, because that's where you're really gonna reach people. That's when we really turned the tide in terms of getting black people vaccinated, when we started going through those.
Absolutely.
Right? And I think it's 4:15. We're almost timed out. Last words or thoughts that anybody want to give to this interaction, everything that we've been going through? Anything else y'all want to add before we cut back to Sacramento?
I think this is dope. I think that, again, finally public recognition, because we did this every Saturday growing up. We may not have been with a camera, but we were still holding court, having conversations about different things that were happening. So I think using this space for black men is going to be effective as far as helping us improve, so that we're not the low-hanging fruit or the pawns on the American chessboard if we are having another pandemic of some sort. Because I think, again, if we don't see how we are vulnerable from what we have been through over this past year and don't feel a need to adjust that, then we got a problem. Because I don't think any of us really enjoyed the risk and the fear that we had. So, I think that using this space to have these conversations, and we should have them on a regular basis, I think is critical, because, again, it helps the brothers in the community.
Absolutely.
And in this age of social media, it's important right now, but the video that's going to play from this, people could watch while they're driving to work or, at any point in time. So, I'll volunteer, my spot to do this on a regular basis. We've been doing it unofficially, but I think, now that we record these things, it's certainly we're able to reach more people.
Absolutely. Closing words?
I'd like to say, as men, as black men, whatever profession you're in, utilizing those resources, utilizing the information and the education that you have. I'm from an era where I like to talk to people. You know what I'm saying? See somebody in the street, little head nod was good. Anything that's a conversation starter. Seeing young men in a barbershop, in the street, in the store, and engaging in conversation with them, just to see where their head is at. Just to, I feel like it's good to have conversation with people that you don't know all the time. And me, for myself, I like to utilize those platforms to educate and to find a point where I could say, I'm a nurse, and they like, I know a man could be a nurse. That stereotype and stuff like that. Just, still educating ourselves, reaching out and tapping into the resources and the people that we know, no matter what the profession is, and utilizing that to help pour that back into our community. So,
absolutely, gentlemen, this was dope. This was amazing. We appreciate this. We appreciate the conversation. Trine, we appreciate everything you having us. This is dope. Like, I've never seen a barbershop with a crest. Right, and that's one of the most amazing things. Yeah, so just huge shout out to you. We want to shout out Better Angle Productions for helping us out. We want to shout out DJ Alter Ego for being here and being on Jack. We want to shout out our film lady. We want to shout out all of the members of Omega Psi Phi Fraternity Incorporated that rolled over to help us out. All of the members of Kappa Alpha Psi Fraternity Incorporated that stepped out to show us love. Just thank you, Capital City Black Nursing Association. We appreciate it. For the annual one, we're going to make this bigger and better. For the local one, we're going to do this more consistently. So, giving it back out to y'all, nothing but love. All right.
5 seconds. You gotta put all your money away.
Oh, yeah.
No shit, man. Boom. I'm back in the barbershop with my man Rasheed Sadiq.
That's right. That's
You know
right.
what I'm saying?
Yes,
Now,
sir.
I'm gonna just let you tell the people who you are.
Okay, so I'm Rasheed Sadiq, as he said, and I'm a community activist, a nonprofit founder and president of Lift Up Love Always, and a short for Lula. I named it after my mother, who passed away when I was 26, and I'm a little bit older than that now, but I wanted to, just a little bit. So I wanted to create this nonprofit to kind of honor her and give my community the love that she gave me.
Okay. Now, what does Lula? Well, you told us what it stands for, but what does it do? What is the focus of Lula?
So Lula is to provide services in the gaps where services in our communities, and I say our communities, the Black and brown communities of Sacramento, in the areas of health disparities, technology, education, and employment. So I try to assist my community in those ways through Lula.
Okay. Now, how did Lula come to fruition? We know how the name came, but how did you actually get the organization off the ground?
Well, I have over 25 years of nonprofit experience in Sacramento. I've been the vice president of the Urban League, Greater Sacramento Urban League, that is, the Center for Fathers and Families. And I also have co-founded LEAD, Law Enforcement Accountability Directive. And through all of these actions or experiences, I've been able to develop a plethora of community connections.
A plethora. A plethora of them.
Yes, sir. And so I wanted to utilize that to benefit my community. And so I do a lot of advocacy around police reform and education.
Okay. Now, what do you think is like the next step in Sacramento when it comes to mental health and specifically with Black men and mental health?
I think, first of all, we have to first as Black men, and I'll include myself, we have to get regular checkups. I've just recently been diagnosed with type 2 diabetes in December. So I've had to alter my eating and try to figure out different ways to be healthier and to make sure I get that exercise like you just spoke to the doctor about, making sure we exercise daily, we eating right, making sure that we eat our good foods, but we eat it in a healthy way. So that's what I'm doing.
Okay. Yeah. How is that going as far as with the changes that you had to make? Because no, the eating is hard. Like,
yeah,
we all know, but no, I ain't gonna say that. Everybody don't even know what they're supposed to be eating, what they shouldn't be eating. We have ideas, but once you get the information, how hard has it been for you to make those changes?
Well, I have to admit it. In the beginning, it was real hard. For me, I had to change some habits. You know,
what was the hardest thing to give up?
Hardest thing to give up was that late night eating.
Oh yeah.
You know what I mean?
Yeah.
Sometimes that late night sugar, or I would have a tendency to knock off some cookies or a little cereal or something. You know what I mean? And so I just I had to change my habits. And so I also cut back on my carbs.
Why do you make it sound like cocaine? The late night sugar, the cereal.
Oh,
y'all know what I mean.
Oh man, I mean, but it is an addiction. You know what I mean?
Drug, yeah.
Sugar is a drug, and so I gotta give homage to my father, who was also a type 2 diabetic, who was diagnosed, I think, when he was about 45. I'm 50 now, and so he's been able to help me to kind of formulate my eating habits, to coach me up on taking my not my insulin, but my medications on a normal basis, and make sure I got a schedule. You know what I mean? And so that also plays into my mental health, because it had me kind of questioning everything I was eating. And so now I really look at food different.
Yeah.
You know what I mean?
You went from what they say, eating to live versus living to eat.
That's right. That's
you had
right.
to make that change.
I had to make that change. Yes.
Yeah.
Yes. That's from the Nation of Islam. Dr. Elijah Muhammad came. Yeah.
Yeah.
All right. All right. Yes. I see
I
you. I see
I be
you.
studying some teachings, man. You know
All
what I'm
right.
saying?
All right.
I got a book or two.
No, okay. Okay.
You know what I'm saying?
We with it.
I don't watch the YouTube video or three. You know what I'm
However
saying?
you get it, man. However you get it. Right.
So, with your background,
Yes,
you talk
sir.
about with the advocacy and all the things that you've done for over 25 years.
That's right.
Serving greater Sacramento community when it comes to mental health and community organizing.
Right.
That's what we're
That's
saying,
right.
Organizing
That's right.
communities, right? How can and should we be advocating for Black men's health in Sacramento?
I think we have to stop listening to our friends and get real information like we've been getting today. Our doctors today are right on the front lines of medicine. And so they, instead of us getting false information, you know, from Facebook, our friends, our uncles, our aunties, we need to get real information before we start to spread those rumors. I call them rumors about vaccines and COVID. You know, a lot of folks didn't even believe that it actually existed, like it was a facade. But I got friends who are nurses who are on the front line and seeing it firsthand every day. And so I think we first have to take our health serious. I think Black women, they go to the doctor on a normal basis. Men, we only go when we, you know, darn near need to go to emergency. You know what I mean? But we need to start having regular checkups with our doctors and get to know our doctors.
Okay. And yeah, man, tell the people where they can find you and where they can get more information about Lula and other things that you're doing in the community.
So Rasheed Sadiq, you can reach me on Facebook. You can reach Lift Up Love Always on Facebook and on Instagram. You can also email me at rsidque@lulagivingback.com. And that's GIVEN, giving.
Boom. There you go. My man. Appreciate you.
Peace and love.
You heard that. Peace and love.
We back. Barbershop Health Talks. How you feeling, Aaron?
I'm feeling great. I just had a Red Bull. I'm feeling it.
It all came together, man. It was a lot of work, labor of love. This is Carter Todd here, Capital City Black Nurses. Over on the West Coast, we just want to give a lot of shout outs to our East Coast partners with this. Greater New York City Black Nurses. Dr. Julius Johnson held it down. Who else, Aaron? Who else helped out today?
Oh man, the Guild. Let me just say, the Guild Theater has been amazing.
Shout out to the IT team.
Yes, the IT. They've been taking care of it. They've been dealing with us. We high stress. We're in the back, giggling and laughing and talking it up, and they like hunting us down in the street. So yeah, definitely they've been great.
And I really want to give a shout out to world class faders across the way. I got the plug over at the Sac Kings. My friend Jess, she hooked us up with a little something something. So. A barber over there that I spoke to, D Speed, excuse me. We got a nice little swag bag for you. We got the sign joint here, so we'll be taking that over there for you. And then there's a bunch of stuff. It's a heavy bag. I can't take it all out, but just showing love, man. We really appreciate you. All the organizations that were a part of it today. Who do we got? We got My Brother's Keeper Sacramento. We got Trap Medicine.
Brother Be Well.
Brother Be Well. We got Lula. Lift Up Love Always.
Yeah, I get those individual contributions. Dr. Tyree Davey.
Tyree Davey. Dr. Atalo Brown. Who else we got? We got our sponsors. UC Davis Health. Betty Irene Moore School of Nursing.
I just graduated, so shout out to them.
He just graduated.
You're alumni, so
I'm
I joined
I'm
your
alumni.
ranks.
Yeah,
Yes.
and we appreciate you all for watching. Honestly, it's been a fun process. It's been really just really fulfilling to be able to give back in this role. We're nurses by trade. We ain't spokesfolks and we ain't IT people, so it's been nice to stretch ourselves a little bit.
Also, shout out to all the barbershops that participated. Very important part was to collect some data. That way we could move and get this program bigger, right? What worked? What didn't work? What did you want to see, right? And so thinking about those barbershops, we got CC's over in North Natomas. We got 5 Star Fades Del Paso. We got Spotlight in Elk Grove, Florence. And then he already talked about World Class Faders. All our volunteers, we have members at all those shops, which is incredible. All the owners, thank you for opening the doors to us. We really appreciate it. Who else?
DJ Soup on the ones and twos. Appreciate
DJ
you.
Soup over there mixing it up. He got cut on. Okay, cool. And then we got VJ in the back.
Yeah. Really, just thank you all. On behalf of Capital City Black Nurses, we're excited to bring this to you, the first installment of our Barbershop Talks, and we'll be back with you all very shortly. If not this year, then next year. We appreciate it, y'all.
Peace.
DJ Soup. Gotta be super or something.